Morning. My name is Teresa Singleton, and I am the Vice President of Community Development Studies and Education at the Federal Reserve Bank of Philadelphia. And it's my great pleasure to welcome you all here today at the National Museum of American Jewish History for what is the first in a series of meetings we're calling Capital for Communities. A key focus for the community development function across the Federal Reserve System is understanding how capital flows and sometimes does not flow to low and moderate income communities. Through our research, convenings, and webinars, the Capital for Communities series will explore both traditional and innovative programs and tools that can direct much needed financial resources to address critical community development challenges. Today's meeting, which focuses on Pay for Success financing, is our first conversation in this series, and we're so excited to have such a diverse group of stakeholders here with us today in one place to discuss this program. We have over 160 people registered, and all of you have a range of knowledge and understanding of the Pay for Success model. So we've tried to design this event to meet people where they are in their learning and understanding. Whether you're just learning about Pay for Success, like me, or you consider yourself fairly knowledgeable on this topic, this event is designed to meet your learning needs. What we've done is we've invited some of the nation's foremost experts on Pay for Success and social impact investing, and we've asked them to help educate and inform us all on the ways in which this tool can be used. And I encourage you all to ask challenging questions of our presenters and our experts to help figure out how this tool can be used to advance our work in community development. They are here as a resource, and I want you to pepper them with questions. I want them exhausted when they leave here today. That's my challenge to you. We've also built in some networking sessions into our day today to help advance our thinking about this topic. So in these small group discussions, we hope to encourage a dialogue that will continue beyond today's event. We're really interested in fostering a discussion around how the Pay for Success model can be implemented here in our region and working with others to identify the partnerships and creating infrastructure that would be needed to implement successful programs both here in the district and beyond. Before getting to my real task this morning, which is introducing our opening speaker, I'd like to take care of a couple of just quick housekeeping items. First, we want today to be interactive, and we want to involve as many people in the conversation we're having as possible. So I encourage those of you who use Twitter to share your thoughts using the hashtag PFSPhilly, and you'll see a sign on your tables to help you remember that. Additionally, we'll be videotaping much of today's conference and broadcasting via live stream, so you see the camera behind you there. So if you want to ask a question, I'm going to ask that you wait to get a microphone because we want to be certain to capture as much of this discussion and share it with our fellow attendees who are joining us online. And lastly, we want to hear from you about the quality of today's event and your thoughts about future work the Federal Reserve Bank of Philadelphia can do in this space. So I'm asking that you all take time. There's an evaluation form in your packet. Please take time to share with us your thoughts, not just on the quality of the meeting, how good the cookies are later on today, but also on the real work that you think we can be doing to contribute to this dialogue and to this effort that's underway. So with that, it's my great pleasure to introduce our opening speaker, Patrick Harker. President Pat Harker took office in July of this year as the 11th President and Chief Executive Officer of the Federal Reserve Bank of Philadelphia. Before taking office at the Federal Reserve of Philadelphia, Pat had a very distinguished career as a scholar in the fields of engineering and business operations, and he's been a leader at local academic institutions, serving most recently as the president of the University of Delaware and previously as dean of the Wharton School of the University of Pennsylvania. In both of those roles, and now here at the Fed, Pat has demonstrated a drive for innovation and a passion to make our region an economic engine for the future. Since he's been here at the Philadelphia Fed, he's shown a real interest in community and economic development and an understanding of the role that it can play in contributing to the regional economy. So I ask you to please join me in welcoming President Pat Harker.
Well, thank you, Teresa, and good morning, and thanks everyone for coming to this event, this gathering on Capital for Communities, exploring Pay for Success financing. And I'd really like to thank a few people when I start, as I start. Thank Inglis and Philanthropy Network Greater Philadelphia for participating in planning this event. And I'd also like to thank all the talented speakers, everybody who's come from near and far, who have joined us today to share your insights on Pay for Success financing. As Teresa said, a new tool that has the potential to generate societal cost savings through an evidence-based social investment approach. Lastly, I want to thank the Community Development Studies and Education Department of the Federal Reserve Bank of Philadelphia for organizing today's event. You know, across the Federal Reserve System, the Community Development Function provides research and gathers stakeholders to explore emerging trends and issues in low-income areas throughout the country. And we are pleased that our colleagues from other Federal Reserve banks and from the Federal Reserve Board of Governors have joined us today. Research-informed practice and practice-informed research are the key goals of the Community Development Studies and Education Department. Today's event will highlight Pay for Success, an emerging model that allows the public, private, and nonprofit sectors to work together to move from good intentions to good outcomes. This model uses metrics that not only track success, but also allow us to learn from the potential failures. It is wonderful to see practitioners, researchers, and policymakers here today as we explore together strategies to support research-informed public investment. I believe this region has incredible potential. Greater Philadelphia is home to some of the world's most renowned centers for higher education and cutting-edge applied research. We are seeing connections emerge among these institutions with technology transfer centers, entrepreneurs, and investors working together to reshape our city into a center for innovation. Our region's economy has been strengthened since the recession, with unemployment in Philadelphia County down to 7.6% as of August 2015, and that's down from a January 2013 rate of 11.9%. According to figures from the Economy League of Greater Philadelphia, from 2009 to 2013, Philadelphia experienced new business growth of nearly 9%, equating to 2,700 firms. Additionally, Greater Philadelphia has experienced a surge of 45% in international visitors over the past decade. Whether to see the Pope or to attend the upcoming Democratic National Convention, people are coming to Philadelphia and taking advantage of the wide variety of local restaurants, shops, and cultural attractions. Despite this, not everything in Philadelphia is rosy. We have our share of challenges, too. Philadelphia is the second poorest large city in America, with a poverty rate of 26.5%, according to the latest U.S. Census figures. Philadelphia also has the highest deep poverty rate of the nation's 10 most populous cities. That is, people with an income below half of the poverty line. While Philadelphia has experienced recent job growth, the rate of growth has been slower than that of other U.S. cities, and the jobs are predominantly low-wage jobs that perpetuate rather than reverse the cycle of poverty. Despite the Philadelphia area being home to a number of leading colleges and universities, only 24% of city residents have a bachelor's degree or higher, and nearly 20% of the adult population does not have a high school diploma, according to the latest U.S. Census figures. Other significant human capital issues plague our region as well. More than 106,000 youths and young adults aged 16 to 24 in the greater Philadelphia region are not in school and not working. Philadelphia has one of the highest incarceration rates of any large U.S. city, with 8,300 people in the Philadelphia prison system. Further, these individuals face significant challenges when re-entering society, contributing to a costly recidivism problem. A recent report by the Pew Charitable Trust showed that the city of Philadelphia spends 7 cents out of every tax dollar on holding people in its jails, which is more than it spends on streets and the health departments combined. Nearly 60% of these prison inmates return to the Philadelphia prison system within 3 years of their release. How do we combat this problem? Experts cite supportive housing, mental health, and substance abuse services, and workforce reentry as service gaps that directly relate to recidivism. As the cost figures in this example show, there is a strong economic case for delivering successful preventative social interventions. Targeted investments in preventative social services could help our region capture unrealized economic gains by unleashing the full potential of human capital improvements. However, traditional sources of capital to address these problems are limited. We know that capital is unlikely to come from the private sector, the public sector. Municipal governments are under stress, revenues are insufficient to cover basic expenditures, the costs associated with debt service, pensions, and other post-employment benefits are consuming a substantial share of scarce resources. And for many cities, the unreserved balance in the general fund provides little financial cushion for the future. At the same time, federal government programs are not growing, and the philanthropic sector can only do so much. Pay for Success offers a new potential source of investment capital. But, as with any proposed solution or program, we need to better understand the nature of our challenge. We also need to assess how this tool can contribute to a vision that is sustainable and inclusive, bringing opportunity to every neighborhood of our city and every city in our region. The strength of our economy greatly depends on the skills, ability, and financial stability of our workforce. Investing in human capital is a strategy that can ultimately lead to both improved quality of life and economic growth. We're here today to explore a new financing tool that allows for that investment in human capital. This new social finance tool, known as Pay for Success financing or social impact bonds, has been applied to reducing recidivism and homelessness and improving educational performance and public health. These are all endeavors that, if successful, could lead to higher labor market participation and lower unemployment and thus promote economic growth. After years of seemingly stagnant results in addressing certain social problems, many people are optimistic that Pay for Success financing will bring solutions in the form of new capital to support program delivery, improve accountability, and increase rigor in performance measurement. Pay for Success financing shifts the risks of our preventative social service from taxpayers to investors who finance these programs and who receive government repayments if and only if the agreed upon performance metrics are achieved. Third-party evaluators measure a program's success, which encourages research-informed practice that can deliver measurable results. Last year, Fed Chair Janet Yellen cited research on the importance of early childhood education as a building block to opportunity that could reduce rampant inequality. She noted that, and I quote, "Research shows that children from lower-income households who get good quality pre-kindergarten education are more likely to graduate from high school and attend college, as well as hold a job and have higher earnings, and they are less likely to be incarcerated or to receive public assistance." Chair Yellen also explained that gains in early childhood education enrollment have stalled since 2010. Only 41% of children were enrolled in state or federally supported programs in 2013. Access to these programs, most of which are specifically designated for low-income families, is limited by available state or local funding, and since the Great Recession, many programs have sustained budget cuts. Pay for Success financing is a potential strategy to preserve these important investments in social programs. By leveraging private capital during times of fiscal stress, taxpayer dollars are only deployed once cost savings through social outcomes have been realized. Although only 8 Pay for Success projects have been structured nationwide to date, nearly 50 are currently in development. Throughout the 3rd District, the Philadelphia region, stakeholders are beginning to explore applications of this investment model. For example, in Philadelphia, a group is working to secure investments in housing for persons with disabilities, to give them the opportunity to live in integrated community settings while delivering cost savings by shifting from institutional-based care toward home and community-based services. In the Lehigh Valley, a task force was assembled to promote investments in early childhood education, aimed at improving educational performance outcomes over time. In Camden, a collaborative effort is underway to provide investments in supportive housing to decrease homelessness and generate societal cost savings from reductions in emergency room visits from those considered high utilizers of the healthcare system. There has been widespread enthusiasm about the potential of this innovative model, but at this early stage, important questions still need to be explored, including what is an appropriate investment term that will also allow enough time for a program to yield results, and how successful programs are sustained after that investment period ends. Could there be unintended consequences from this approach? And lastly, how can projects be best structured to allow for learning from potential failures, as well as sharing best practices from successes? Preventing problems such as homelessness, educational underperformance, recidivism, and poor public health, these are critical for the long-term economic health and prosperity of our region and our nation. Philadelphia native Benjamin Franklin, father of American innovation, said, "An ounce of prevention is worth a pound of cure." The Federal Reserve Bank of Philadelphia is hosting this event and this meeting because it makes economic sense to explore new ways to prevent the social problems that plague our society today. And we know that successful social investment will contribute to a stronger economic future. The presence of both local and national leaders here today is a testimony to the broad interest we share in exploring innovative ways to work together toward these goals. Today's discussion will provide opportunities to understand and to focus on different perspectives about the purpose, appropriate uses, challenges, and risks of pay-for-success financing. The goal of this event is to create a community of interest around the development of social impact bonds and to identify opportunities for government officials, potential investors, and service providers to leverage pay-for-success financing to implement on or scale social innovations. Over the past few weeks, I've been traveling around the district, and I've been struck by a number of things. How different our economies are from community to community, and how hard our residents, community organizations, and the public sector are working to affect change. It's actually inspiring when you go around the district and see all the great work that's being done. But one exchange in Allentown really stood out for me. We met with a private developer who had made various investments to revitalize the downtown area. He was celebrating the successes and envisioning the future for a new and improved Allentown. But in mid-conversation, he voiced his concern that the low and moderate income residents of Allentown were not seeing themselves in the bright future for his city. They were not applying for the new jobs that were available, they were not shopping in the new stores, and they were not eating in the new restaurants. He asked some folks representing the local nonprofit community what he needed to do to make sure this changed, that the Allentown of the future was an Allentown for all residents. I mention this today because it highlights a critical component for today's meeting. There is interest from the private sector to find solutions, and this interest can be leveraged to bring about transformative change. For real change to occur, however, conversations have to begin, which brings us back to the purpose of our event today. This meeting highlights the importance of connecting a diverse group of stakeholders and creating a dialogue that encourages a collective approach to local issues and opportunities. This challenging work requires an approach that is at once creative and forward-looking. The strategies you will learn about today exemplify how social finance innovations can unite public, private, and nonprofit stakeholders by allowing risk, return, and impact to be allocated so that everyone's needs are met while delivering social outcomes that cannot be achieved by one party alone. A shift toward evidence-based public investment will not be made without significant effort, and it would be easier to stick with the status quo and just hope for the best. But let's not let the fact that there is no handbook on how to do this stop us from innovating in ways that could potentially improve the lives of some of our most vulnerable neighbors, while also saving scarce public resources. After all, the handbook on innovation is not read it's created. Thank you.
Hi, my name is Noelle Baldini. I'm a Community Engagement Associate with the Federal Reserve Bank of Philadelphia, and I'm going to be moving us through the agenda today. So at this point, I'm pleased to welcome our first panel up to the stage. This panel will be moderated by Ian Galloway. Ian is a Research Associate and Community Development Field Manager at the Federal Reserve Bank of San Francisco, where he researches and presents regularly on community development topics, including crowdfunding, investment tax credits, the social determinants of health, impact investing, and pay-for-success financing. Ian recently co-edited Investing in What Works for America's Communities, a collection of essays jointly published with the Low-Income Investment Fund on the future of anti-poverty policy. He also published the article, Using Pay-for-Success to Increase Investments in the Non-Medical Determinants of Health, in the November 2014 issue of Health Affairs. Thank you for traveling from the West Coast to join us, Ian, and I will turn it over to our panel.
Great. Should I stand or sit? Or do you... Okay. Let's see here. I can't really see the screen, but I'll sit. Thank you, Noelle. Thank you all for coming today. I am very excited to be here. This is a topic that I'm very passionate about, and I want to apologize in advance. I'm going to come across as somewhat of a cheerleader for this. But I want to say at the outset that this is not a panacea, and there are a lot of legitimate concerns about whether or not this is an appropriate tool in all contexts. But for this presentation, I'm going to pretend like that's not the case. So I come at this from the community development and community development finance standpoint. And for those of you who are new to community development, this is an industry that's fairly substantial. It's largely driven by Community Reinvestment Act bank dollars. That was a law passed in the late 70s that requires regulated banks to invest in low-income communities. The consequence of that legislation has been the community development industry, which is largely affordable housing, but also community facilities and other community building assets. But it's mostly real estate. I think if you asked, I don't want to make something up here, but I'd say 90% of what we do in community development is develop real estate. And I think that reflecting on how the industry has developed over the last 40 years, I think we are at a point where we can acknowledge that we've had a great deal of success rebuilding disinvested neighborhoods, the physical landscape of those neighborhoods. Over 3 million units of affordable housing have been developed with the low-income housing tax credit alone. Millions of square feet of commercial real estate. Huge successes. But I think we all acknowledge that we're not where we hoped we would be 40 years later, and that we haven't moved the dial on a lot of the social outcomes that we care deeply about. So what really animates me about Pay for Success is that it creates a financial tool to invest in human capital alongside physical capital. So I think it complements the important real estate development work that the community development field is already doing very well. And it's been a missing piece for a long time. So that's what gets me excited about Pay for Success as a concept, is that it can complement all this good work that's already happening. So I'm going to walk you through sort of a 101 on Pay for Success, why it's important. I'm going to walk you through one particular project. It's the Utah Early Childhood Pay for Success project that many of you have undoubtedly heard of. And then I'm going to conclude with just a few frequently asked questions that I get after giving presentations like this, and I'll attempt to address those. But I'm sure my fellow panelists will like to weigh in on those as well. So let's dive in here. So, and I can't see the screen, so it's going to be interesting. So first of all, I just want to start with some definitions. So Pay for Success is an umbrella, and Bill and I were actually talking about this at dinner, and thank you for reminding me to mention this. It's sort of an umbrella term that includes a lot of different approaches. So the one that I'm going to focus on today is what's sort of known as the social impact bond approach, which is by far the most complicated, complex version of pay for success. But there are lots of other ways to do this. Prize-based philanthropy, tax increment financing, incentive clauses for community development loans tied to improving social outcomes. Lots of ways to do this. This is sort of the top, as Bill describes it, sort of the top rung of the ladder when it comes to pay for success. But I'm happy to talk about all the other ways this could be done as well. So the big innovation here is, of course, that we're paying for outcomes instead of for promising programs. So I think the mistake or the path that we've been on for quite some time has been that we have social challenges that we want to solve, whether it's homelessness or joblessness or incarceration. And our solution to those problems is to find the best program to address the people in those circumstances. So we put an RFP out into the world. We get a number of applications from qualified nonprofits. We do our best to pick the best one, and we fund that organization up front. And we let them run their program, and then at some point in the future, hopefully, we check back in with that nonprofit to determine whether or not they've actually moved the dial on whatever it is that we care about, and that it's improved the outcomes of these vulnerable populations in some meaningful way. So that's been sort of the status quo approach to solving social problems. The innovation here, what makes Pay for Success interesting and different from that approach, is that instead of paying for promising programs up front, we're paying for outcomes once those programs have run their course, which is a fundamental shift in how we evaluate program effectiveness. So that's sort of the big innovation here. And it sounds like a technical fix, but it actually has a number of rippling effects on how the social sector works and the interaction of the private sector and the public sector. So in order to make all of this work, and again, this is in sort of the context of a social impact bond approach. And by the way, for those of you who are new to this, social impact bonds are actually not bonds, or they're typically not bonds. They're actually just loans to nonprofits. So it's confusing. That's why we call it Pay for Success, because we're trying to make it less confusing. But when we talk about social impact bonds, we're in effect talking about Pay for Success. So in order to make these projects work, at the heart, you have a performance-based contract. And that contract links a nonprofit, typically. It doesn't have to be, but what we call sort of a service provider, an organization that's capable of producing a social outcome that you value. So the contract links that service provider, that nonprofit, with an end payer. That end payer values the social outcome, whether it's a reduction in homelessness or foster care utilization or special education utilization. It values that outcome. That end payer is typically government or an agency of government, because government is the one usually bearing the costs of a failure to address that social outcome. So it's in their best interest financially to see that outcome achieved. But it doesn't have to be. That end payer could be a foundation. So take the Robert Wood Johnson Foundation, which is the largest health foundation in the world, $12 billion under management. They value improving public health. So potentially, the Robert Wood Johnson Foundation could enter into a contract with a nonprofit that ties a success payment to some health outcome that is valuable to the foundation. So instead of granting money to a nonprofit up front, RWJ would commit to paying for an outcome should it be achieved in the future. So it could be a foundation, it could be a health insurance company, it could be a hospital system. The point is it's an organization or an institution that values a given social outcome for whatever reason. So that performance-based contract links the nonprofit with the end payer. It also spells out sort of the terms of the project. What are you allowed to do? What are you not allowed to do? Who's eligible to participate? And also, what are the terms of the evaluation, which is incredibly important, and I think it's going to be a lot of what we talk about on this panel. Who comes in and evaluates whether or not effectiveness, whether or not success has been achieved? What are the terms of that evaluation process? Is there a randomized control trial? Is it a pre-post comparison? All of these things are spelled out, or should be spelled out, in that performance-based contract at the outset, because obviously the last thing we want to do is get to the end of a contract period and for there to be any question about whether or not success was either achieved or not achieved. That's just an invitation to litigation. So that first piece is sort of at the heart of any kind of pay-for-success approach. The second piece is the financing. It's the investable opportunity here. And this is the consequence of paying nonprofits at the end of a process as opposed to at the beginning of a process. So as we talked about earlier, typically we fund nonprofits at the outset and then we hope that their work produces an outcome. In this case, we're waiting until the end to pay for that outcome, which means the nonprofit has a funding gap. They need to raise money today to run their programming in exchange for using their success payments or some portion of their success payments to repay whoever it is that's lending them the money to run their programming. So that's the investable opportunity. Investors could be banks. They have been banks. They could be foundations. They could be high net worth individuals, impact investors, basically anybody or organization that is willing to provide the upfront capital for nonprofits to run their programming and, importantly, take on the risk that the nonprofit may not actually produce the outcome that they're contracted to produce. So it's a risk transfer off of the end payer, government, and onto a private sector investor. So those are kind of the two big pieces of pay for success, that performance-based contract, and then the investable opportunity created by that funding gap due to paying for outcomes as opposed to paying for promising programs at the outset. So that's pay for success sort of in a nutshell, and that's somewhat of a simplification. And again, every one of these projects looks slightly different, and there are lots of different ways to do pay for success. This is more or less the social impact bond approach to PFS. So I'm going to walk you through one project. This was the second project that was closed in the United States. There have been 8 so far, and I see some folks in the room who actually worked on this project, so I'm going to apologize to them directly right now, because I'm sure I'm going to get some of this wrong. But this is in broad brushstrokes how this deal came together. This is, as I mentioned, the second project in the country. It was an early childhood education initiative in the state of Utah, and I don't think this is unique to Utah or Salt Lake. A lot of kids from low-income families were showing up at kindergarten so far behind that the state had no other option, responsibly, than to track those kids into special education to sort of remediate that initial detriment. This is obviously very expensive, paying for special education that would otherwise not be necessary if these kids were kindergarten ready. It's also not great for the kids because they otherwise could have been mainstreamed, and this puts them on a different trajectory. So this was an effort to increase investment in a high-quality preschool program that had been in operation actually for some time before, proven effective, and in this case it was the county. It's now the state, and we can talk about that. But the government would be willing to pay for that investment in high-quality preschool based on how many kids avoid special education who otherwise probably would have needed it. So the way that it works is 600 kids were given, roughly 600 kids were given high-quality preschool, and this was in school year 2013-2014, so this was actually 2 years ago. The children, all 600 of those kids were given a test before they arrived in kindergarten, before they arrived in preschool, actually, the Peabody Picture Vocabulary Test. Those kids who tested 2 standard deviations below the mean, which is very, very low, were placed in the sort of eligible pay-for-success payment pool. So that was 110 of the 600 children who received high-quality preschool. And again, I can't really see what I have on my slide here. in order to provide 600 kids with high-quality preschool for that year, they needed to raise $1.1 million in investment from investors. That investment came from a combination of two sources, a senior loan of $725,000 from Goldman Sachs Bank, and a subordinate loan from J.B. Pritzker for the remainder. The United Way of Salt Lake played an intermediary role in this project, and that's very common for Pay for Success. There's usually an organization sitting at the center of the transaction that's managing the relationships of the people participating in the project. In this case, it was the United Way. And then the payment terms were roughly $2,500 back to both Goldman Sachs and J.B. Pritzker for every child, kindergarten through 6th grade, that falls into that success payment pool. So that's the 110 kids that avoid special education, triggers a $2,500 payment up until the point where both Goldman Sachs and J.B. Pritzker are fully repaid their principal investment of $1.1 million. And then the success payments effectively get cut in half. And the way to think about that is it costs roughly $2,500 a year to provide special education in the state of Utah. So up until the point where the investors are fully repaid, the investors received 100% of the cost savings, and then from that point on, they split it with the state. So I'm just going to walk you through the transaction structure very quickly. In this case, the end payer was a combination of Salt Lake County and the United Way of Salt Lake, which is an unusual circumstance. It's not common. It's due to the fact that the state of Utah at the very last minute was unable to appropriate funds for this. The state of Utah was supposed to be the end payer in this transaction. It fell through at the last minute. The county and the United Way of Salt Lake stepped up and said, we will pretend to be the state for a year to pilot this, and we're going to use that year to go back to the legislature and get them to pick it up permanently going forward. That's exactly what happened. So now just imagine the state of Utah as the end payer, but for this first cohort of kids, it was a combination of Salt Lake County and the United Way. So again, what gets all of this started is that initial contract between an end payer and a service provider. Once that contract is in place, the service provider or the intermediary acting on the service provider's behalf reaches out to subordinate lenders. In this case, it was J.B. Pritzker providing that $375,000. Once that's in place, they can reach out to a senior lender. In this case, it was Goldman Sachs providing that $725,000. The combined $1.1 million was then dispersed to the high-quality preschool program. They ran the program for a year. An independent evaluator came in and measured how many kids accessed special education in kindergarten after that initial year of high-quality preschool, which determines how much success payment funds are then released from the end payer back to the intermediary, which is then used to repay the senior lender first, and then subsequently the subordinate lender. So this is, again, an oversimplification of the transaction, and there are folks in the room, I'm sure, who are pulling their hair out, but this is kind of a boilerplate example of how these projects come together. I can tell you that the results for this initial cohort were just released, actually about a month ago, and they were off the charts successful. So of those 110 children who received high-quality preschool that were in that success payment pool, only one required special education. So 110 were highly likely to access it, and only one ultimately ended up needing it. So very successful example of high-quality preschool reducing the need for special education. So as I mentioned, this is still relatively new. Only 8 projects in the country have been completed thus far. You can see them on the list here. They fall into roughly 3 buckets, more or less. The big bucket so far has been recidivism, so projects that reduce criminals reoffending and going back to prison. Part of the reason for that is that incarcerating people is very expensive, so it makes sense if you can do anything else really than incarcerate them, you can save the system a lot of money. So a lot of these projects have gravitated in that direction. Early childhood education we talked about both in Utah and also in Chicago. supportive housing for the chronically homeless in Santa Clara County and in the state of Massachusetts, and then foster care avoidance for the children of homeless mothers is I guess the fourth. So relatively new, relatively untested, but huge opportunity here. As was previously mentioned, there's about 50 deals in some state of development across the country. This is supported in large part by significant grants from both foundations and government. There is currently a $300 million Pay for Success bill that is being considered by Congress. It's bipartisan, and from what I understand, it has a reasonable chance of passing as much as that's possible. So that would obviously supercharge the industry if those funds were available at the federal level. $11.2 million was recently dispersed, and you'll hear about this probably from Dave Wilkinson later today, from the White House, the Social Innovation Fund. These funds will be used to support deal construction across the country. $5 million grant went out last year from the Irvine Foundation and NFF to support 5 projects in the state of California, and then most recently an $8.4 million grant from the Arnold Foundation in Houston to support deal construction at the Urban Institute. So a lot going on, a lot of money floating around, supporting some of these early deals. But again, this is still relatively new, and we don't quite know where it's going to go. So before I close, I wanted to address, as I mentioned sort of in my introduction, a few frequently asked questions that I get when I give this presentation, and I suspect you both get them as well. And I welcome any correction of my answers to these questions, because I think they're all sort of open questions, and I think we're sort of to some extent building the bicycle as we ride it when it comes to Pay for Success, and some of these questions are sort of unresolved at this point. So the first one that I always get is, if we know that a program works, the high-quality preschool program in Utah, for example, why don't we just fund it directly? Why is it necessary to create this massive financial infrastructure to support evidence-based programs that we could just fund directly at lower cost? And the answer to that question, I think, is that I think generally we overstate how much we know about program effectiveness. We talk about evidence-based programs as though that we have hundreds of them around the country that we could easily tap to solve all of our problems, but the reality is that there are very few truly evidence-based programs, and a lot of times we don't really know if an intervention is going to work. I can tell you that I'm working with a project that received a Social Innovation Fund grant in Oregon to reduce foster care utilization. And they did a landscape assessment of all the foster care, abuse and neglect sort of nonprofits across the country, and concluded that in the aggregate, only 12% effectively reduced the need for foster care, which is to say 88% of nonprofits that do this work across the country are ineffective in actually improving the outcomes of the people that they're working with. And obviously that's, again, an oversimplification, but the point is that in most cases we don't necessarily know what's going to work, and we're doing the best we can. Government is doing the best they can to evaluate these programs in advance before funding them, but that's not translating into the outcomes that we really care about. So this is an alternative approach that just shifts the risk, again, off of the government and onto the private sector to determine whether or not a program is going to be effective at the outset. So that's why we don't do it. If we had more evidence-based programs and government was good at identifying them, this would not be necessary. Will this privatize the social safety net? It's sort of two quick answers to that. I think in large part we've already privatized the social safety net. The legion of nonprofits that governments contract with to solve any number of problems is the privatization of the social safety net. This is just changing the way that we pay for those nonprofits. Instead of paying for promising programs, we're paying them to produce social outcomes that are valuable to us. I would also say that, and I mentioned this sort of again in my introduction, that the community development finance field and community development as an industry is very, very good at this. This is not a lot different than funding an affordable housing project, where private money comes in up front and it's paid back over time from public subsidy. This is not fundamentally different from that approach. And it really rests on a foundation of public-private partnership. So I would argue that this is sort of a proven mechanism in the community development context, and we're just applying it to a human capital development context. So it's not as radical as it may seem on its face. Thank you. So this is, I think, a really, really important question. And one of the potential risks here is that we sort of get out in front of our skis on this without thinking through the potential fraud and abuse challenges. And I think there's going to be both fraud and abuse eventually, and I think we need to prepare ourselves for that, and I think we need to be careful simultaneously not to throw the baby out with the bathwater when that happens. Whenever you create a financial incentive to do anything, people are going to find a way to game the system. So I would just say that as we think through these contracts, as we write these contracts, let's be very, very careful about how we describe the type of programs that are allowed within the context of the contract. And let's be very careful about how the measurement is done. The evaluation is very, very important. We need to be absolutely sure that the government is only paying for legitimate social outcomes and not the appearance of social outcomes. And the example from the healthcare field that I would point to, just as a cautionary tale, when nursing homes shifted from being majority nonprofit to majority for-profit, there was a 4-fold increase in the use of sedatives among their patient population because it's cheaper to sedate a frail elderly person than it is to provide face-to-face interaction with them. So you create an incentive, and you're going to get some potentially unintended consequences. So let's just be very careful about how we write these contracts going forward. How can small nonprofits operate in this sort of new paradigm, this new world? The reality is that this is not a good tool for small nonprofits, particularly those nonprofits that have difficulty measuring their outcomes. I think potentially we could get to the point where pay-for-success contracts are used as kind of a master contracting tool. So a large, high-capacity nonprofit would sign a performance-based contract that would pay them for achieving social outcomes. Then they would use the investment that they receive on the basis of that contract to subcontract with small nonprofits to provide pieces of that overall solution that will trigger the success payment. So I think there's a role for nonprofits in pay for success, but not necessarily a direct contractual role the way that we see with the projects so far. Will good projects go underfunded because they don't produce enough bankable cash savings? This is a very serious issue. There's a lot of social outcomes that we value that are not necessarily tied to bankable, significant cash savings. That doesn't mean they're not important, and we need to make sure that this tool does not divert significant social spending away from good projects just because they don't happen to produce bankable cost savings. And then finally, where does this go next? And I'm sure we all have different answers to this question. What really gets me excited about Pay for Success is the potential to increase investment in the non-medical determinants of health. So for those of you sort of unfamiliar with the social determinants of health and public health generally, a substantial amount of what predicts your life expectancy happens outside of the medical system. It happens in your neighborhood, happens in your household, in your family. Obviously, we spend about $3 trillion a year on the medical system, and we don't spend a fraction of that on where health actually happens. And so what really gets me excited about this is what if Pay for Success could finally bridge that gap and get the medical care system to start paying for prevention in the community and not wait until people get sick to pay for high-cost treatments to treat that disease. So I see that as a huge untapped opportunity to really expand Pay for Success, and it's a good tool to finally bridge those two fields. So I wrote about that in an article in Health Affairs, which I think there's a paywall. So if you'd like to read that, just email me after this presentation and I will send it to you. So that's Pay for Success in a nutshell. Just to get us started, get the conversation going, it is my privilege to introduce our panel to sort of discuss some of these concepts and really get into the weeds. These are the folks that actually do the work. I just talk about the work. It's a much easier job. So to my right is Bill Pinikevich. Bill is Vice President of Advisory Services at the Nonprofit Finance Fund, a CDFI and intermediary. And to his right is Jeff Shumway, who is also a Vice President of Advisory Services at Social Finance US. They are a national intermediary that does Pay for Success deals, and sister organization of Social Finance UK, which is the nonprofit that invented the social impact bond. So a very impressive lineage. So I'm going to ask them to just give a quick 5-minute introduction about what they're doing, why this is interesting, and then we're going to go into sort of a moderated Q&A, and then if we have time, we're going to turn it over to the audience after that. So, Bill, you want to start?
Sure. And so part of this also is to kind of identify for you the framework and the lens through which Nonprofit Finance Fund looks at the field of Pay for Success. And we've been, since 2010, when this came over from the UK, we've been actively involved in the field and building out the infrastructure to support it and understand it. And we've had a very disciplined approach towards this to be what we call an independent, honest broker in the Pay for Success field. And that has a couple of components to it, which again will help frame and give you some sense for the lens that we look through when we talk about Pay for Success. So we do a lot of work in the education and exploration of Pay for Success. And those of you who have been following it know that we have a Learning Hub website called www.payforsuccess.org. Kind of easy to find on that basis if you're looking for it. But we also do a lot of work with localities, governments, and providers in educating them on Pay for Success. And what we'll talk about at some point during the day, we spent the better part of 2013 in several meetings with this city's task force on Pay for Success as they investigated whether or not something in Pay for Success would make sense for them to pursue. So that's the one piece that we do. We also spread recognition of Pay for Success and how Pay for Success approaches can be effective and what the challenges are of Pay for Success. So we've been involved in events like this over 100 during that period of time, which my calculation is about 2 of these a month that our team does over the course of the last 5 years, spreading the word about not only what the opportunities are, but what the challenges are. We also build and manage initiatives for Pay for Success project structuring and accelerated learning. And 2 mentions of that were already made. In partnership with the Irvine Foundation, we are managing the California Pay for Success Initiative and also are managing the transaction structuring for the Social Innovation Fund Pay for Success project as well. And lastly, we incubate and accelerate provider capacity and outcomes in an outcomes-driven environment. And we run things called these provider readiness boot camps, which are literally boot camps, and have a big focus on sort of the role of the provider in these transactions. And we've talked about this a bunch. We've gone through sort of the detailed structuring and the mechanics of how to make a Pay for Success project work. And a fundamental analysis, when you come right down to what makes it happen, it's whether or not the provider performs. And so provider capacity and what's required for that is something that is a very strong focus and lens that we look at with this. And so what we strive to do is have a very balanced view on this, not just the opportunities and the promise, but the challenges as well. And we try to avoid what our CEO, Anthony Buglevine, calls the hypers and the haters on this. And there are very strong opinions on the polar opposites. Is this a good thing? Is it not a good thing? And what we try to do is to bring the balanced perspective on that. And even good things have bad things about them, but if they're identified and we're transparent about it and deal with them, they can be addressed. So that's the perspective that we bring on this, and we'll come back to it again and again. And the other thing I'd add, just as kind of a summary to this, We don't view pay for success and social impact bonds as ends in and of themselves, okay? The object of the exercise is not to do deals. The object of the exercise is to learn from them how to change the system to make it more responsive and able to produce meaningful and measurable outcomes for individuals, families, and communities of need, and to bring the capital necessary to do that. And if all we ever do is a couple of interesting transactions in the pay for success field and don't change the system to operate more like those transactions do, we will have been involved in some very expensive and interesting experiments that didn't amount to much. So that's our perspective.
Thanks, Bill. Jeff?
Great. Thank you. And I want to second what Bill just said. I think a lot of folks get caught up in the financing and the evaluation and in a lot of the technocrats speak in social impact bonds. The point here is to change government systems, to allow government innovators to have a new tool to allow them to flex their systems in a way that makes sense for everybody, especially the participants. So if you take nothing else away, know that the point here is the systems change, not to create a new asset class for investors, right? That's not really the point. Not that they don't need another asset class. I also wanted to congratulate Ian Galloway, who just did a wonderful version of PowerPoint karaoke where you don't know what slide is coming up next. We can present it anyway. It was very well done. As a former recovering consultant, I appreciate that skill set. So very quickly, social finance, as Ian said, we grew out of social finance in the UK, which pioneered the model. Here in the US, we were founded in 2011 with the same founders, but with a new CEO, new governing board, new management structure. Our mission is to mobilize capital to drive social progress. Again, we are a 501c3 with a mission to drive social progress. So everything that you hear today, I think, is around that social progress point. We have one deal that was launched in late 2013 in criminal justice, and we have 7 now in development, and I can talk through those in a bit if people are interested. We operate, again, in criminal justice, but also we think there's a huge opportunity in a couple of other issue areas where we haven't seen deals yet, but we think we will very soon. So workforce development has a lot of potential. If you know anything about the new WIOA appropriation at the federal level, it actually includes 10% of all funding can pay for outcomes, can be used in a pay-for-success way. And there's also a governor's reserve, which provides another 10%, which can be used in that way. So a huge opportunity there. In public health, as Ian said, the social determinants of health are crucial. The ACA is pushing clinics to think, it's pushing clinicians to think outside of the clinic, to get into homes, to get to the community, to address these social determinants of health. We think pay for success can be a way to do that, shifting the risk to investors as you're exploring those new interventions. And also within education, no one's really cracked how to do this beyond preschool because there are some interesting incentives and the payoff is very long-term in education. We are actively working on how to apply this within education in a couple of really interesting ways. So the 7 deals in development, I'll tick through them quickly, but we're working on adult basic education and vocational training in Massachusetts, especially for those who are learning English. We're working on a maternal and child health program in 3 different states. This is the Nurse-Family Partnership. So many of you have probably heard of this, but a wonderful evidence base around that home visitation program. We're working there in New York State, South Carolina, and in Michigan. We're working on an asthma home remediation program with Robert Wood Johnson called GHHI, Green and Healthy Homes Initiative in Baltimore, and then ideally 10 more sites after that. We're working on a veterans, workforce, and mental health national project with Bank of America and the Wounded Warrior Project. And then in Connecticut, we're working on, in the child welfare system, addressing substance abuse so that families can stay together. So where the parent has a substance abuse issue, you can keep the children in the home. And then lastly, in terms of what we do and the perspective we bring, we are in the guts of these. We put together the projects themselves. So I help on the advisory side, so helping governments, philanthropy, nonprofits think about whether pay for success is right for them. Then we have a whole deal structuring, deal development team, and my colleague Casey Littlefield is here from that team. They do the actual program design, negotiate the contracts, do the financial structuring, and then actually raise the capital. So we will commit to actually raising you the capital if we think it's a good project. And then lastly, I also oversee what we call active performance management. So one of the unheralded kind of pieces of these projects is that because you have outside funding and because you have a contract around specific outcomes, and typically you have data sharing from government, you can do very active, continuous improvement, course correction, program refinement as you go. You typically get more flexibility in the contract than you would normally have with government, and we use that to the fullest. So we're actually on the phone with providers, with government every 2 weeks when we get a data feed from them talking about how to course correct and make the program better so that we get the outcomes that we all want. So that is social finance in a nutshell. Back to Ian.
So I think the question that a lot of you have on your mind here is around the evaluation piece. How we measure success, how we determine whether or not we've achieved that success. Can you both just spend a couple minutes talking about the different approaches to answering that question that have been tried so far, and maybe spend a couple minutes sort of weighing the pros and cons of a more intense evaluation process versus something that's a little bit easier to accomplish, lower cost, but potentially not as robust in terms of evaluation quality. Because at the end of the day, when we're talking about buying and selling outcomes, the measurement is going to determine whether or not what you're buying and what you're selling. So this really is at the heart of this concept. If you can't measure it reliably, then these projects sort of implode. So maybe just a couple minutes on evaluation, and then we'll pivot.
Yeah. So, I mean, this is a graduate level masterclass question. We could spend days on this, but I'm going to restrict myself to making a couple of points and then let Bill clean up whatever I don't say. The first thing I want to make clear is we sometimes say data and evidence and outcomes and wave our hands and think we're talking about one thing, and I want to just pull it apart for a moment because evaluation is one of the things there. The first thing that we look for when we're putting together a project is pre-existing evidence that a particular intervention can move the outcomes we're looking at. So there's an evidence piece, right? That's a formal evaluation, ideally quasi-experimental or even experimental, randomized control trial. Then we need data, current data, not historical, to look at the target population we'd be going after, right? So the targeting piece is very important. Then we need data that fuels the evaluation. How do we know if we've been successful, which then triggers repayment? That's a very formal, again, evaluation, which is arm's length, third-party, objective, not related to any of the parties in the transaction for obvious reasons, right? Because there's a conflict there. And then there's also data which flows so that I can do my active performance management as the intermediary, right? So all four of those pieces we feel are critical to making these work. And so just in your conversations about pay for success, when people say it's data-driven, you need to unpack that a little bit and say which piece of data or which piece of evaluation or measurement are we talking about. So in terms of evaluation, I think there's a very real trade-off in doing very high-end evaluation to trigger the repayment versus something much lower. And the way I'm thinking about it currently, and this changes every couple days because I learned something new from one of the projects, if you have a project which has some evidence but it's not great, it's not randomized control trial, multiple trials in different contexts, we typically like to have a randomized control trial as the triggering mechanism for the evaluation, for the obvious reason that it's more secure, right? It's more confidence-inspiring for the investor and the payer that they're getting what they're setting out to get, but also because it builds knowledge and evidence as we go, which is part of the purpose here, right? If we have something that has rock-solid evidence to begin with, I feel much more comfortable with something which is more quasi-experimental, or even just you measure against a historical baseline, which is sort of what Utah was doing, right? They knew that 2 standard deviations below on that PPVT test was going to need special education. Based on that historical baseline, they just said, we will pay out on anybody falling into that category on that test that doesn't end up in special ed, right? So that's sort of the cleanest, simplest, least rigorous way you could trigger repayment. If I know that this program works from prior evaluation, I'm much more comfortable with that as an evaluation. And so there's a rigor trade-off. There's a trade-off for the payer and the investors in terms of what risk they're willing to take, how much noise in the evaluation, and then there's a clear cost component here. It's very expensive to run a randomized control trial. You automatically whack in half the number of outcomes you're going to get because half of the people are not going to get any treatment. They're going to be in a control group, and obviously you can change that ratio at times. And it drives up the cost tremendously to have a really high-quality evaluator involved. So we're constantly trading off this question of, do we need the rigor here, or can we do something less rigorous? We don't have a fixed opinion on that. There are a lot of people who do. I think our role as the intermediary is to do what's right for the deal, and especially for the end beneficiaries and the system in the end, so that we learn what we need to, and we're confident that we have a robust enough evaluation that the deal can hold.
Yeah, and so the wraparound concept on that, he is in the trenches doing this stuff all the time, is to kind of have the rationale behind all this. Okay, so these are all proof of concept pilots, every one of these transactions right now. And proof of concept is an interesting phase because the concept we're trying to prove is whether or not it makes sense to have this structure where we only pay for programs that work and produce these contracted outcomes. So you have to have a way that everyone agrees to measure that sort of a thing. And a big part of this, as Jeff points out, is the objective of this is to change the way government operates with these sorts of things. And so standard of proof and proof of concept transactions has to be pretty darn high. And attribution, can the results be attributed to the intervention itself has to be part of that as well. And so RCTs and all that becomes a big part of that mix. There's already conversation in the field about is that level of evaluation necessary for all transactions, for all ways of doing this, and is there a more nuanced sort of range and continuum of evaluation that makes sense? And as we move from proof of concept to this being more mainstream, I believe you'll see more nuance on how evaluation is done, what's acceptable rigor for what purposes, et cetera. But for now, the standard is really high and needs to be high. Because convincing that governments that this works needs to reach a high bar of proof. So that's piece number one. When Jeff went through the description of what's required to do this stuff, I kind of put on my provider hat here, and I think about the capacity internally as a service provider that it takes for data capture, data analysis, use of data, the management of data for continuous improvement, the reporting of the data, and all that, and how much investment in capacity and capacity building for providers is required to get them up the curve on this. So that part of the evaluation piece still needs to be addressed by the sector. Who's going to fund that? And if everybody wants these outcomes, they have to pay for that capacity in some way, shape, or form. And it's no surprise then that of the 8 transactions that have been launched, not completed, I want to correct that. Okay, they've been launched, not completed. Uniformly, the organizations involved have been at data collection, data analysis, continuous improvement for years. Self-funding, by and large, as well, right? So I think that's another component of it. And what the evaluation brings to bear is a focus on the full cost of delivering those outcomes that are baked into this. And if this routine doesn't pay for the full cost, including the evaluation, this is going to fall apart. I think the last piece of this is not to be overlooked is, a lot of focus on the evaluation is, have we met the trigger to make the payment? And sort of that whole sort of way of unleashing things and proving that things have been done. The learning from that is really, really important stuff. And that's baked into both our California Pay for Success initiative and our Social Innovation Fund piece, a very specific commitment to sharing the learning from these things. Okay? So I would say that's the wrapper that kind of I want to emphasize with all of that. The other piece that we found out in this evaluation, because everyone's so invested in the objectivity of that, is one of the interesting things that's come out of this is who pays for the evaluation. Because if any one of the parties to the transaction has a cash flow that goes to pay for the evaluation, it kind of taints the results. So you'll see in most of these transactions, the evaluation has been funded by someone outside the transaction. And that probably is going to be the case going forward as well. Okay? Someone with a hand, you want to?
Sure, yeah, we can take a quick question.
Yeah, great question. Sorry. Yeah, so just to repeat the question, I spoke about the Veterans Mental Health and Employment project that we're working on, and the question is, who's the payer? It's an interesting one. The federal government is not in a position to be a payer except in a couple of very specific situations. So I think it's SSDI is one, and the VA is another, because they have wholly, and Medicare actually is another good one. where they pay 100% of the funding stream. They're not splitting it with the state in some way. So we are very hopeful that the VA will come in as a part of the payer. We have philanthropy that's also going to act as payer in this case. And just in general, I feel like payers that are non-governmental only make sense if they are there to sweeten the pot and incentivize government to come in and become involved. Because again, I think our purpose is to change the way government funds flow. And so if you just have a philanthropic payer, it feels a lot like, you know, a pot of money here that's repaying a pot of money here, and all of it is separate from government, and you're not actually getting the systems changed.
So I'd like to just pivot really quickly to sort of one of the, I think, unresolved questions that we debate a lot. I debated it on our panel call before this. But it's, again, sort of an unresolved issue that I think is going to be very important to how this field develops going forward, and that is, fundamentally, should we use pay for success to scale programs that work, or should we use pay for success to surface innovation to solve problems for which we don't have good solutions? And if it's the latter, are the returns that investors are currently getting sufficient to reward that risk-taking activity? And if they're not, how do we solve that problem? Do you guys want to take a shot at that?
Sure, I can take a first. We'll just switch back and forth every start.
Tag team.
I'll start by conjuring up my favorite sort of phrase here, which is, first of all, let's avoid the binary trap. Doesn't have to be door number one or door number two on this. Personally, I would contend that you can and should do both of those things. And structures are already in the marketplace that allow you to use this for innovation as well as for existing high-quality projects, bringing them to higher scale. And they've been doing that by putting upfront little proof-of-concept pilots in transactions where they haven't been yet proved or don't have existing RCTs, things of that sort. So there's no reason that you can't do through a pay-for-success vehicle, whether it's social impact bonds or otherwise, both scaling of existing proven programs and new innovative programs, but certainly the risks involved in both of them are very different. And it implies a different approach towards structuring. It applies a different approach towards the recruitment of investors, et cetera. But again, I would augur for not falling into the binary trap and looking for structures to do both.
Yeah, this is a really interesting question. It's one that we actively debate week in, week out at Social Finance, because we have to make decisions about where we're comfortable applying the tool and raising capital based on the level of evidence that we see pre-existing. And I guess I'll make several different arguments which are not internally consistent. So
That's what we like about you, Jeff.
Yeah, it's many personalities struggling in here, Bill. But on the one hand, I come out of the social sector, philanthropy and nonprofits, and I think if you've been following that sector at all, there's this huge ongoing conversation about scale, right? We know what works in some targeted small ways, and then when you try to replicate those, we tend to fail. And I think we've fallen into a trap there where we say, hey, there's evidence around this intervention. This intervention works. And actually what the evidence is saying, for this target population, in this context, in this geography, this intervention works. So replication has been a big issue for us generally in the U.S. That leads me to say, hey, if we have a way now to take those things that work and shift that replication risk and execution risk in a new geography or with a slightly different population to the investors, and then bring government into the conversation as well about scaling it up, that seems like a great use. That seems like it solves a wonderful problem to me. So that's where I say, let's just replicate. Let's take the Nurse Family Partnerships, the Center for Employment Opportunities out of New York, the ones that have a randomized controlled trial already that we know we should be doing everywhere, and just stamp them out. Let's just do them, right? So that's the one side. The other split side of my personality would say, incremental improvement in large core funding streams for government makes a lot of sense too. So if we can take this from being a niche thing that we do on the side into core funding streams, I'm happy to do that. And if to do that, we have to say, we'll take whatever program you're doing now and help you make it better, that's really appealing to me too, right? So it depends how I think it depends a bit about how you view the way you're going to change government and their funding flows coming into it. The other thing to note here is every single one of the deals that's out there involves some element of innovation. Yeah. So if you look at CEO, the Center for Employment Opportunities, which is our provider in our New York State criminal justice workforce project, they have a randomized control trial. They are very fidelity conscious. They replicate well. We were replicating with the same target population within the same geography and the same funding context for the most part. But what changed was the referral pathway. We knew from an MDRC study that we did better if we grabbed guys sooner after they came out of prison, and we knew that we did better with the higher risk guys. So we shifted our targeting slightly, created a new referral pathway with the parole officers, and just that innovation alone has added some risk and required a lot of operational work. So I guess my point is there is innovation even within replication, which I think goes back to your binary point. Yeah. There's both going on.
And I think this also raises another issue here about fidelity of replication. It's kind of been a given concept. In order to replicate, you have to have fidelity to the structure and the concept. And I think what Jeff is pointing out and what we're learning through Pay for Success is you have to have situational flexibility in that fidelity in order to adapt to the context in which you're working. And the contracts need to allow for that flexibility. And I think part of the struggle that's been going on in Pay for Success so far is how tight do the contracts need to be to give everybody comfort that their interests are being addressed properly, and how loose do they need to be to allow for learning in the field to adapt to the context. And I think both of those issues you're talking about, being able to innovate within replication, is a perfect example of having to have enough flexibility in addition to the tightness in those contracts to allow for learning from field experience. If you don't do that, square peg in a round hole comes into play.
Something tells me that the next panel that's going to look into the Rikers Island social impact bond is going to address that very question.
Good chance.
So we're running out of time here. I want to leave a couple minutes for audience questions, so I'm going to give you a quick rapid-fire question. It's a surprise question, just to keep you guys on your toes. I know I do. I like doing this. So project 15 years into the future. Two scenarios. And we talk about Pay for Success sort of in sort of these grandiose terms, right? Transformational, paradigm busting, systems change, right? So two scenarios. We have changed the system. It's a new paradigm. It's sort of Pay for Success all the time. What does the dystopic version of that future look like to you? And what is
the first part of that? And you can do the second.
And what is the utopic version, which is to say, we now have built a new system for ourselves. It's a new social sector. It's a new paradigm. What are you most concerned about if we move in that direction, and what are you most excited about? Really quickly.
I'm going to change the order. What I'm most excited about is the possibility that foundations start funding the capacity of a wide swath of providers to be able to operate on the basis of outcomes. They create contracts with their grants and otherwise to purchase those outcomes at full cost and establish a template that government can then take on and change the way that they do their procurement and funding of social services. That's the good part.
Okay.
The dystopian part is that this becomes something that is wrapped up in the mechanics of financing, and it kind of goes down a path where this is something that the financial institutions, both commercial and otherwise, sort of take over, and it gets kind of lost in the shuffle of all the rest of the capital market sorts of things, and we lose focus on the fact that it's all about mission, and it's all about bringing better, measurable, positive results to individuals, families, and communities of need.
It's funny, your utopic vision actually is the beginning of my dystopic vision, which is an interesting
This is
conversation.
why you have both of us on this panel.
That's right. We'll have to talk at lunch. I think I worry a little bit. So there's sort of three views of the future. One is that SIBs take off and become this asset class, and you've got a lot of money pouring into them, and impact investors come in, and it becomes standardized and becomes like a muni bond. I actually don't think that's going to happen for a bunch of reasons that get back to the risk and return question that we didn't quite get to earlier. I think, for me, utopia, I think, is core government funding streams incorporate the learnings of Pay for Success. So they focus on outcomes, they use data and evidence well, they involve quite a bit of active performance management and flexibility after they're up and running, and they provide longer-term flexible funding for nonprofits to do work that is preventative in nature rather than remediation. So that's my utopia. I guess I get worried that we get caught in the philanthropy trap, because right now we're finding that a lot of these deals can only happen because of certain pressures in certain jurisdictions. They'll only work with philanthropic dollars on both sides. So you need philanthropy to help pay for the evaluation and pay for our services to put the deal together, and philanthropy is coming in as an investor, as a subordinated lender. It may be that this just becomes an effective philanthropy play, and this is the way grant making happens in the future, that philanthropy pays for outcomes. And I worry a little bit that when that happens, it gives government an out to say, we don't need to do this because philanthropy has that nailed. And it's frankly a lot harder for government to change its inner workings than it is for philanthropy to change its grant making. And so I worry a little bit about getting caught in that eddy.
And I'd say the order of magnitude of the two funding streams are such that you really need to move that way. And systems change is a process.
Yeah.
And it has steps that need to be gone through. And I think, I think we can probably both turn these things around to the same. And I'll stop there.
Do we have time for
A couple more?
maybe 5 minutes? Okay, that'd be great. We're going to go into the break a little bit. So here's what I'd like to do, since we only have 5 minutes. Can we get 2 questions? Can we ask them both at the same time? And then you guys can jump in to answer either one of them or both as quickly as possible. So can we get two? And please stand up, introduce yourself. Back here, yes?
So I know this is early, obviously, we're sort of writing the book, but it seems to me at this point that this could favor projects that have short-term outcomes and impacts. How do we get to the point where we're able to use this so that we can actually look at longer-term impacts? Some projects like affordable housing may not have, impacts that are really measurable, until 5 years and later out.
That's a great question. Second, right there. Yep.
Hi, my name is Abelal. I'm from Geneva Global. And I was just curious, given that there's so many parties involved, how did these initiatives typically get started? Who is the initial idea generator? And then also, what is the order of the other partners that start to then get pulled into the deal? And then how long do these deals typically take from idea to getting it off the ground?
So a short-term and a long-term question.
Yeah, I'll knock out a couple of those. Right now, it takes about 18 months to put one together. That is too long, and our business model is going to explode if that remains the case. So we're actively trying to innovate around ways to make that better, faster, cheaper. And then in terms of the short-term outcomes question, it is much easier to do these deals around short-term outcomes. Actually, we've gone after relatively long-term outcomes, at least relative to a normal government contract. Our deal is 5.5 years. We measure after 4 years. One of the outcomes is 12 months are you employed 12 months post-release. The recidivism measurement runs throughout the 4 years of the cohort. So I think it's pretty good medium term. The struggle I mentioned with education is that those are so long term, right? If you help a kid be literate in 3rd grade, you really have to wait until the long tail of savings for when they graduate high school. And so that's part of what we're having trouble cracking in education.
Yeah, I'd say the whole thing about short-term focus on outcomes, keep in mind we're in a proof of concept stage. This is not how we're going to be forever with this. In a proof of concept stage, none of the players have a grasp on what all the risks are involved here. And everyone's trying to get their arms around the risk assessment and trying to understand it so they can value their participation. That all augurs for keeping timeframes short in the proof of concept phase, and it would imply that once you establish proof of concept, once the participants get a better handle on risk, understanding it and managing it, those timeframes can be extended over a period of time. But we're talking time, long time, years. And how long these things run, I agree with Jeff. I mean, at one point there was a curve that was shortening from the start to the launch of transactions, and then it seems to have extended again a bit here. I think because we're taking on new mission areas, we're taking on more complex structures, it's maturing as a system. And I think you have the stair-step function in these sorts of things, I think, with that. And in terms of who starts these transactions, it's all over the place. It's all over the place. But one consistent piece of this always is, without a motivated government partner and champion, it's hard to get traction on this sort of a thing. But the origins, the initiation of this has come from any one of the stakeholder groups.
Right, there are a lot of times when I feel like we do a feasibility study and then we're flogging that around to different levels of government to see who's interested. But to me, it doesn't actually kick off until you've got a committed government payer and there's an RFP that we can then win the mandate to develop the deal.
Right.
And there's no abundance of providers ready to deliver on this either. So that's the other piece.
It's all coming together at the same time. We're out of time. Thank you guys so much. That's why I love talking to you. Please join me in thanking our panel.
We are going to take a quick 15-minute break. There's a beautiful terrace if you want to step outside, but we do ask no smoking. There's also coffee, restrooms. We'll be back in about 15 minutes. Again, if everyone wouldn't mind finding their seats, we're going to move to the next panel. We have a lot to cover. So before I introduce our next panel, I just briefly wanted to introduce John Roman from the Urban Institute, who would like to share a bit with you about a new program opportunity some of you may want to take advantage of. So, John?
So I feel a little bit like a party crasher, so I feel like I should tell you a joke, but I don't have one. I work at the Urban Institute in Washington, D.C. We are a nonpartisan, nonprofit economic and social policy research organization, which means we're a classic Washington think tank. We've been working around social innovation. I know some of these folks from 2009 on back around Pay for Success and social impact bonds. We have, due to the generosity of the Laura and John Arnold Foundation, we have very large grants that I believe Ian described, and to help grow the Pay for Success sector. And so some of that work is going to be developing toolkit products. We think there's a lot of really wonderful 101 kinds of products out there in the universe, but we want to create some 201 products so we can scale this sector and provide the information that takes us from where we are today to where we need to be to answer that question about where we can be in 15 years. We're creating communities of practice, and these are the two things, and I'll say this really fast. So we're creating communities of practice where we have governments who are involved in these transactions at the county, state, and municipal level talk to each other about what it's like to be involved in one of these transactions and what information they need in order to move these products forward, and learn from each other and have us listen in and figure out what we need to do to make governments to make this more tractable for governments. We want to do the same thing for social service providers and potentially intermediaries. So anybody who's in those spaces should think about connecting with us, and we will engage you with other colleagues and just listen and not tell you things. The other thing I want to say was we have released a notice of support availability, what we call the NOSA. We wanted to differentiate it from a NOFA, because NOFA suggests we're going to give you money, and I'm not going to give you any of my money. But I'm more than happy to give you our time. So we have a lot of technical expertise at the Urban Institute. We have 200 PhDs in pretty much any subject area that you are interested in exploring. And if you would like support in trying to understand what the research actually says today, how to create a research design that will inform a Pay for Success transaction, or do the sort of implementation science stuff that Jeff Shumway talked about in terms of understanding what's working as you go along. You can connect with us, apply for our NOSA funding, and we will connect you with researchers who can help you. And I will stop there and turn over this great panel and say, please stop me if you want to talk. Thanks.
Great. Thank you, John. I'm pleased to introduce our next panel. This morning, we really heard about some of the concepts, and now we're going to dig deeper through 2 case studies. This panel will be moderated by Eileen Neely, Director of Capital Innovation at Living Cities. Before joining Living Cities in December 2012, Eileen had been the Director of Strategic Planning at the District of Columbia Housing Authority, overseeing the development, implementation, and measurement of the agency's strategic plan and moving to work plan. Previously, she was the Chief Operating Officer of the Fresno Housing Authority in Fresno, California. Eileen also previously served as the Director of Public Entity Lending at Fannie Mae, where she provided technical assistance and financing to cities, counties, and housing authorities throughout the country to help them address housing needs. So Eileen, I'm happy to turn it over to you. Thank you.
Thanks, Noelle. So I'm going to keep introductions really short because their bios are in your book, and I think you care more about the topic than who we are. So I'm just going to quick go and go down the line. First, we have David Merriman. He's from the County of Cuyahoga, which is where Cleveland is located. So he's here representing the government perspective of a Pay for Success transaction. Next, we have Andy Ratchlin from the Reinvestment Fund, representing an investor perspective for Pay for Success. Sorry, can't see who's next. Next, we have Russell Spieth. And he's from Frontline Solutions, the provider in the Cuyahoga Pay for Success transaction. And then we have Katie Appleduda, And she is from Bloomberg Philanthropies, representing philanthropic perspective on Pay for Success in the Rikers Island transaction. And then finally, we have Andy Phillips from Goldman Sachs, another investor perspective for Pay for Success. So that's who we are. And first, before we get into questions and answers, we're going to have very brief descriptions of two Pay for Success transactions so that we can go into specifics and talk about how these things work. So first is, I'll turn this to Noel. We have, can I go first? I think that's you, David.
Sure. First, thank you very much for including us today. I'm here on behalf of our county executive, Armin Budish, and the rest of the county government. Before I get into our deal, I thought it might be worthwhile just recognizing the environment in which we developed this Pay for Success deal, and also to ask for your indulgence as I recognize folks from around the room, organizations from around the room that helped us on this, because I think that Patrick Harker nailed it when he talked about this is a conversation, and it is important for you to know that there are many voices and many partners in our deal, not just those of us that are sitting up here. And so the Cuyahoga County deal was the first county-level Pay for Success project in America and the first to tackle child welfare. And if I can just very quickly run you through our progression and then get us to the deal. So we took 3 years to develop the deal. It was a very long time. As the first county government, there was very little for us to look to in terms of support, and that was probably less time than others would need moving forward. I'm sorry, that was more time than others would need moving forward. The other thing that I would recognize, we were very fortunate in that we had foundation support from the beginning. The George Gunn Foundation, Marcia Egbert, played a key leadership role. The Gunn Foundation funded Third Sector Capital Partners from the onset, and they were our technical assistance provider throughout. The other major asset that we had is Case Western Reserve University, and they're an early member of the Actual Intelligence for Social Policy Group. Claudia Coulton, David Crampton, they helped us with our own administrative data in a way that we would have never been able to progress through Pay for Success if we didn't master our own administrative data to start. The story goes quickly that in 2011 we were invited to the first White House convening on Pay for Success and had an opportunity to get to know the Nonprofit Finance Fund, and Nima Crodell and Nora McVeigh, others, and since we've gotten very close with Anthony Buglevin. And at that convening, I was there, I heard about this great idea, I brought it back, and our county executive said, let's go for it. With no hesitation, really, let's move forward. And we committed to an open process, to being transparent in our selection and our all of the work that we did. And so we did an RFP. Actually, it was a request for applications, something that doesn't exist in the state of Ohio. So there was a customization to our procurement process. We invited funders to be a part of that procurement because ultimately we wanted them to be investors. And so early on, recognizing that there was a significant role for investors to help select and manage the deal. Through that procurement, Marcia Egbert and Third Sector were actually involved in the decision-making and the review. So we were quite willing to share the authority in terms of making selections. And we structured the procurement in a way that we could identify a single provider to serve all of the roles, or multiple providers, and in fact we could bring together proposals, and that's exactly what we did when we were lucky to have an excellent proposal from Frontline Services and Enterprise Community Partners. And through the customized procurement, we were able to look to Enterprise to serve as the intermediary and Frontline to serve as the lead service provider. We spent about 6 months, and so this was I would say, so procurement was from September 2012 through June of 2013. We spent the second half of 2013 doing a deep dive into our model and doing our own due diligence. We then spent the first half of 2014 jumping into what the structure of the deal would work, how it would work, and in that we had the support of the Harvard Kennedy School, as well as Laura and John Arnold Foundation, and they pushed us on the model and helped us to get to, I think, a very good design. And in moving into the summer of 2014, we created legislation that developed a social innovation finance fund, which is where we parked our county dollars to be able to fund the deal. And it took us 5 months to get both the legislation, the contract, and then the legislative action on the contract through our county government. And what I'm going to do is I'm going to turn it over to Russell in a second to talk about how that deal was structured. I'm sorry, not how the deal was structured, but how the project is structured. But I just want to quickly recognize a few things. One, we are using a Tier 1 evidence-based intervention as the backbone behind our organization or our intervention. We are doing an RCT, and so 50% of our individuals are being served out of the experimental group, and 50 are in the control group. And we are using our administrative data, so there's not another source of data. And I think that was an important element to this. The last thing that I'd like to just recognize that in all of this process, we've come to recognize relationship is key. It's the relationship of the providers and recognizing roles and counting on each other to move the project through. And in this, we know that we would not have been successful if that relationship had at any point fallen apart. And we also recognize that the providers that were involved in this deal were critical to the safety net of the entire county, and that at no point could the deal ever threaten those roles, the role that Frontline plays as the crisis intervention hotline, or the role that Enterprise plays managing our permanent supportive housing initiative. So it's an important thing that as organizations explore this and look at bringing a pay for success project on, that you have the right players around the table, that it's a big table, and that you have the direct communication early on, saying this is important, but not worth having anybody permanently harmed, because we're all doing important work. So I'm going to stop there and I think have Russell describe our project a bit.
Thank you, David, and thank you all for having me. I'm going to focus, for the most part, on provider performance and some of the factors that we put in place that we think are going to help with the performance of the providers. So one thing is because for our particular project in Cuyahoga County, there wasn't an existing intervention that we were ramping up. We were creating a new intervention based on some evidence-based practices that were existing and putting them together. So for that reason, we really wanted to have a ramp-up period process. I always say this, like, we were ethically and morally obligated to do good work by the folks that we were working with during that ramp-up period, but we weren't responsible in terms of the outcomes yet to the investors. So that allowed us an opportunity for the staff to get training in the model, for us to begin to work out some of the service coordination issues. For example, how will it actually work with referring a client to a particular housing situation? How will that process unfold? We were able to identify some sort of wrinkles in that particular system early on and then pivot. Real quick, brief example is that we were looking at sort of our proxy metrics, basically our metrics that weren't about reducing out-of-home placement days, but that we thought were related to that, like, for example, getting people housed quickly. We realized we weren't getting people housed as quickly as we wanted to, as we thought we would be able to during that ramp-up period, and therefore made some changes to the way in which we streamline getting people's birth certificates and records to streamline and make that process faster. So that ramp-up period was really important for training, for the development of the staff, and for really working out these relationships among the partners. Second thing I'll think has really been important is the operating committee. And Jeff was actually sort of referencing something similar. We meet every 2 weeks face-to-face around a big table, and it's everyone who's involved, all the stakeholders. Only stakeholder who's not present yet are the clients, which we're about to the point to begin inviting clients who've been in the program to be a part of that process. But the idea is we're all in the room every 2 weeks to talk about looking at these proxy metrics, seeing how we're doing, trying to figure out ways that we can make the program more efficient. The people at that table are people who have decision-making power. So if we're realizing there's an issue with referrals that really shouldn't be there, there's someone in that room who can go back to the office and say, we can make this change and therefore streamline this process. That operating committee, I think, has been invaluable, and just sort of a testament to that is that we had the opportunity to go from every 2 weeks to once a month when the full project started. And although we're all very busy, we all felt like it was beneficial to continue to meet every 2 weeks. And again, it allows us to look at data in real time, analyze that data, and make changes based on what we're seeing. Third thing I would say is just the collection of proxy metrics. Again, before this program was started, we were sort of looking at metrics that we thought were going to lead to child permanence outcomes. So like how long it takes us to engage a client and then take them into the program as an example. How long it takes from the time a person is enrolled in the program to when they're housed is another sort of metric like that. Because you know, one of the sort of the fundamental ideas of this program is that you can't reunify until you're housed in a permanent safe situation. So nothing can happen until we can get people housed relatively quickly. If there's a big delay in that, then we have issues. So it's, you know, being able to collect those metrics over time, talk about them, be transparent about it, look at ways we can sort of increase the efficiency. And last, and this one might, I just thought of this one earlier today, was staff resiliency. And I think that's probably one of the most important things. Our particular project is emotionally challenging. There's a lot of secondary trauma staff is experiencing. I'd assume most of the projects you're digging into complex problems with people who are not functioning at their best at the time that we're working with them. It's also being outcome-based is something that most social service providers are not used to yet. So that's taxing on a social service provider too. And we believe, based on relationships, if we have this sort of constant turnover of staff, there's not going to be the sort of the institutional knowledge of the interventions, the relationships, the face-to-face relationships with the providers and with the clients are going to be fragmented. So we really worked hard at having set aside time for the staff to have their own resiliency time and to talk about what the work's like. And what I can say, we haven't had, I'm a little superstitious, we've not had any turnover as of yet, which is pretty dramatic for social service. Usually around a year, you already got people turning over. So those are 4 factors, I think, since deal construction that have really, I think, enhanced the effectiveness.
Thanks, that's really exciting. I have lots of questions. I thought I knew a lot about this deal, but apparently I don't. So I'm really excited. I knew things happened before it got underway. But before I get to do that, we are going to hear from Katie to talk about the Rikers Island deal in New York City.
Great, thank you. So I, as Eileen mentioned, am with Bloomberg Philanthropies, and I'm part of our government innovation team. So I'm sort of representing the philanthropic perspective, but also from a philanthropy and a government innovation program that is exclusively focused on cities and on government. So the work that we do is really aimed at 2 things. One, helping to boost the problem-solving capacity, or the innovation capacity, if you will, of government. And then 2, accelerating the spread of proven, promising approaches among cities. And so Andy's going to walk you through the mechanics of our deal in a few minutes, but I wanted to do a bit of, as you guys have the sort of genesis story of it and what excited us about it. And so as I mentioned, we're really passionate about cities and we're trying to build their problem-solving capacity. So one of the tools that was surfacing around 2010 with the Peterborough project in the UK was social impact bonds, or as Andy often calls them, social impact not a bond, which I like. And so we were really excited about the prospect of this new tool for government. And the reason we were really excited was really around 3 things. One, as we've all been talking about, this opportunity to really unlock capital for new programs in government at a time when resources were really scarce. They continue to be scarce. 2, the shifting of risk from taxpayers to investors. I think we all know, many of the folks in our organization come from government, including me. Government tends to be incredibly risk averse. So the idea of a tool that would enable government to take on new programs, to scale things, was really exciting to us. And then finally, and perhaps most importantly, we were really excited by the sort of data-driven rigor that this type of financing demands, and that all of us have been, I think, speaking about this morning, this movement to outcomes and impact away from activities and outputs, and the real opportunity that this sort of structure created in that realm. And so all of that is sort of what excited us about social impact bonds, and then sort of how did we get to Rikers Island. So in 2010, as the work was happening in Petersboro, as everyone was getting really excited about social impact bonds, then Mayor Bloomberg was in the midst, him and his team, of developing the Young Men's Initiative, which was a really groundbreaking, really broad set of initiatives, policy changes, programs to reduce the disparities between young men of color and their peers. And we as a philanthropy had committed to invest $30 million in that initiative. And it was sort of being developed at the same time that we'd made that commitment. And so we saw a really unique opportunity to potentially bring this financing tool to the United States by connecting it to one of the programs that was emerging through the Young Men's Initiative. And so we were quite lucky in that sense that all of these things were sort of happening at the same time. And the other thing that we were really fortunate about is there were lots of other people who were really excited about the prospect of social impact bonds, who were really eager to partner with us. So the city, as I mentioned, was developing this really broad plan. They too were really excited by all the things that I mentioned, particularly the prospect of unlocking more capital for the programs that they do. MDRC, which is the intermediary in our deal, was really uniquely positioned to serve as the intermediary in a program like this and move quickly to get something off the ground. Goldman Sachs, like us, was really excited to add to their social impact portfolio by using this tool. So it's sort of all happening at the same time, kind of unique circumstances, and I'm sure we'll talk a little bit more about that. And so, I know many of you in the room, I think, are either involved in a deal, thinking about a deal, excited about Pay for Success, and sort of what it might mean for you. We're really excited too. At the time that we were doing the Rikers SIB, there was no one to call. There really wasn't. There was Petersboro, and we certainly reached out to them, but that was basically it. And it was really hard, and I think we're all talking about the time it takes to start these deals and, hopefully compressing that over time. So we are just really excited that there's many, many more deals to look at, to learn from. And I think some of the questions that have come up, and I'm sure we'll hear more, are these sort of what's right, what's wrong in these deals. I don't think we know yet, and I actually think that's the really exciting thing about this work. And so I will stop there because I'm much more interested in the time we'll spend hearing from all of you and sharing what we've learned, and turn it over to Andy.
Right. I need to move this. People should let me know. Can you hear me?
Yeah.
Great. So first I want to say thank you to the Philadelphia Federal Reserve Bank for inviting me here today. I am born and raised in Philadelphia, so any opportunity to come home and have a soft pretzel is always welcome. And that is where you will see me after this panel, because there is no place that does soft pretzels like Philadelphia. Anyway, so just to give a little context for sort of where I sit at Goldman Sachs and why we're interested in these types of investment opportunities. I'm part of the Urban Investment Group, which is essentially an impact investing team. And really what we do is we invest both the firm's dollars as well as now client capital through our social impact fund in projects that have both where we're striving for both strong financial returns as well as really an intentional social impact. The lion's share of those investments over our 15-year history, and those commitments total about $4.5 billion to this point, have really been about how can we help finance this sort of bricks and mortar of neighborhoods and communities. So things like schools, affordable housing, mixed income housing. When we essentially got the call from New York City saying that they were interested in exploring this new mechanism called a social impact bond, and not well named, to Katie's point, for us it was really another opportunity to use the tools we have, which is our investment capital, to address pressing social challenges. And that's really the approach of our work. And so, investing in and financing preventive social services on Rikers Island was really a natural extension of the work we had been doing for the last 15 years. And we really welcome the opportunity to work with such a great group of partners to try and address what is clearly a continuing and pressing social challenge in New York. I think it's really great that everybody has started with the stories behind these deals, because they really are always a story. And I think what's important for us is how the story starts. And I think what you would see if you talk to everybody who is working on a deal and all the deals that have been done, the story typically starts locally. And it starts with a group of stakeholders that often includes government, but it's community leaders and others who have identified a policy priority, an issue in their communities, and are beginning to think about what is the right way to address that challenge. And that's really, as Katie pointed out, the context for the development of the transaction where we finance the services on Rikers Island. So that context and that starting point we think is very, very important, and it again speaks to the importance of partnership in these deals. And for us as investors, we also feel very strongly that those community leaders in government are the ones that are best positioned to identify the interventions, to structure the payment metrics, to really identify what the evaluation is. So that said, as context, what I want to do is walk you through our little structure chart that you can see over there, because I always think a picture says more. And so just to walk through sort of how the capital flowed and what happened in the deal, I think it's useful to use that as a guide. So Goldman Sachs made a loan to MDRC. MDRC is the project manager and intermediary in this transaction. At the same time that we made our loan, Bloomberg Philanthropies committed to fund a guarantee against that loan. You know, as we know in the history of community development, there's often subordinate capital or credit enhancements in place to help sort of crowd in private capital and bring that to a deal. Because this was the first deal done in the US market and really the first deal done with a financial services firm as the investor, that partnership was really crucial, both in terms of providing the guarantee, but also in terms of the subject matter expertise and leadership that the Bloomberg team brought to the deal. So we made that loan, we made that commitment up front. The proceeds of that loan were used to then fund the services on Rikers Island. Those services were provided by the Osborne Association and a group called Friends of Island Academy. They were selected through a competitive RFP process that was led by the city in partnership with MDRC, where the city with MDRC had identified cognitive behavioral therapy as an evidence-based program that they wanted to bring to the young people who are on Rikers Island. They then identified the groups who they thought were best positioned to then deliver that curriculum on Rikers Island. So the proceeds of our loan paid for those wonderful people who went out to Rikers every day to work with those young people. And I think in all of this, we need to remember, as Russell pointed out, those are the folks doing the truly hardest work of all. And I'm going to steal a quote from Dave Wilkinson, who's the keynote at lunch. He describes them as those are the American heroes, and I think we would agree. So going back to my structure chart, as with any loan, there needs to be a source of repayment. That source of repayment is through the Pay for Success contract that was in place with New York City and MDRC. The payments on that contract were intended to be the repayment for our loan. So that gives you a sense of the overall structure. This is the deal that was the first to have results that became public. The evaluation design was set out when we entered into all of these agreements before we got started, and those initial results came out this summer. As many of you have probably heard, those results were not what we had all hoped, and the evidence didn't show any impact on recidivism among the young men on Rikers Island, which was, I think, incredibly disappointing to all of us that were involved in the partnership. That said, I think we reflected on that and felt that while the intervention may not have been successful in doing what we had hoped, we do believe that the financing mechanism did achieve its goals. We as a group identified what the metrics were that we were going to track. We tracked them over time, and then the city used that information at the end of the day to make a decision about the program. They did close the program down at the end of August. The administration continues, I believe, to be very committed to addressing the challenges that those young people face on Rikers Island. But the really important news is that they had the information they needed to be able to make a decision about that program. As Katie pointed out, no taxpayer dollars got used. Goldman Sachs was able to benefit from the partial guarantee from Bloomberg Philanthropies, and we were all able to learn from that experience. More broadly, what I would say is that I would echo some of the comments earlier, which is this really is about a partnership, and what we saw through the whole project is everybody coming to the table and trying to problem solve around what some of the issues were that came up. And I think all partners involved, Osborne Association, Friends of Island Academy, and MDRC, really did an amazing job on delivering a program in a complicated operating environment to try and address one of our most pressing social challenges. So with that, I will turn it back over to Eileen.
Thanks. I'm going to start with Andy, because he's the only one up here who didn't get to talk already. So Andy was one of the investors, or not Andy personally, it wasn't his money. It was...
I had like $20. I did offer it.
The reinvestment fund was one of the investors in the Cuyahoga deal. And Andy, I'd love to hear from you why TRF, we heard from Andy why it's important to Goldman Sachs, but why did TRF, this is so different than sort of financing community facilities and affordable housing, which you typically do.
Oh, that's so easy to answer because Ian already did it for me. The reinvestment fund is a place where policy objectives and financing come together. So anytime there's a sort of new innovation or new thought at the intersection of those two things, we're sort of broadly interested. But the thing that was most important to us was that, we're sort of cognizant of the fact that community development investment historically has been mostly a real estate game, which is really important, but also not the entire story, obviously, right? So the ability to be able to take our particular tool in the world, which is financing, right? Like financing is not the solution to every social problem, but it is our tool particularly. The ability to be able to take our tool and invest in people as opposed to bricks and mortar was the ground level attraction.
I want to encourage you guys who have questions to raise your hands all throughout. We want to make this as conversational as possible. I can ask all my questions, but would love to hear what's on your mind. So why don't we just go ahead and get started with an audience question.
You're not from Philly, you picked Jeff.
Thank you, Andy Rockland. Very interesting. I'm here to learn. I work for the City Controller's Office. And I've heard a lot about this government as risk-averse proposition. To me, government is actually the least risk-averse because they're investing in programs that don't necessarily work. So maybe we need to reframe how I think that. But my question about the Rikers deal is, why was such a short window of opportunity given? And second, and this points to the risk-averse question as well, why did Goldman Sachs need a backstop from Bloomberg? I thought this was about risk sharing. And I know I'm asking a provocative question, but to me it's kind of an important one. Why does a $1 zillion investment bank need a backstop from the philanthropy?
So can I address these to certain people? So one is about risk aversion, and it was actually one of my questions. So David, do you want to take on the risk question?
Absolutely. So I think you point out that government I feel has been risk averse. We are focused on compliance at this point. Our entire system is based around using the bucket of money in the right way, and in that way, so long as we understand how that bucket is to be used, we're quite happy. And we do not think beyond that, even with our own dollars. And so how we move to risk aversion, I actually feel that the spending of money is probably not the most critical component. It's the relationship. It's the sharing of power. and inviting investors in. And if I could just quickly recognize how that's worked locally. So when we actually were taking our Pay for Success contract to council, our county council, we have an executive council structure, we had the reinvestment fund in. They were sitting in the back of the room, and we went up to our council members and we said, our investors are here. They're due diligencing this deal. And we'd like to maintain a good relationship with them. And so to council, what do you think? How do we approach investors in the future? How do we see them as partners? Not just making a one-time investment, but somebody to work with. And that's a real change for government. It's a change for government to say, you're our partner, not just at the point that you issue the check, but how we work with you.
Okay, and so now let's talk about financing risk. And I actually want to change the question around a little and give a huge shout out to Goldman as a huge pioneer in this. They did take real financial risk. They took real financial hit when this didn't work. And they also took the risk of getting the Bloomberg backstop. Every time a bank does a loan, they take some sort of backstop, whether it's the guarantee of their borrower, the backstop of the house when they make a mortgage loan. So having backstop in a lending environment is not unusual, and to call out Goldman for not taking any risk, I think is very unfair. So I'm going to turn it over to Andy, and maybe she doesn't need to answer it, but so she doesn't have to get defensive. I got defensive in exchange.
Thank you, Eileen, for that response. I think what I would say to add on to that is we are an investing team. If you're familiar with it, Goldman Sachs Foundation is a large philanthropy, is oftentimes one of the largest corporate donors listed. We fund a great program here in Philadelphia called 10,000 Small Businesses that supports local entrepreneurs. And I have the most respect you can imagine for my wonderful colleagues in the foundation. We, on the other hand, are an investing team, and as such, we hold ourselves accountable to risk-adjusted returns. And for a lot of reasons, this deal had outsized risk. And as Eileen pointed out, when there is that type of outsized risk, there's oftentimes government or another entity that will come in and provide some credit enhancement and downside protection. And so that's, in fact, what happened in this deal, and we're incredibly grateful, as I said, for both the financial partnership from Bloomberg Philanthropies, but also, perhaps even more importantly, the substantive partnership.
Yeah, I actually want to second that just because I think it's such an important concept that doesn't exist in a lot of the civic sector right now, but is so important in investing. And if the two are going to come together, then it has to become a shared language. And that is, the words that Andy used, risk-adjusted return. That isn't purely theoretical, right? That's math. If you're only earning this much on a given deal, and you stand to lose this much, you can't afford very many losses before you go out of business. So the folks who can afford to take giant swings on risk, the way that Goldman did in that first deal, are venture capitalists in Silicon Valley who can invest $1 million in Facebook 10 years ago and have $1 billion now, because that $1 billion allows them to lose lots of other money along the way, right? Those are not the kind of returns that exist in these kinds of deals, and therefore you can't take that kind of risk over and over and over again if you expect to continue to exist and continue to invest. And that's why, particularly for these early transactions, and I will say TRF, a nonprofit investor that, people probably aren't going to take those same kind of swings at, but we have looked for credit enhancement in our deals too. And, frankly, the field has been going in the right direction, right? Our deals came later than Andy's first deal, and there was less credit enhancement because there had been at least some lessons learned. So we didn't feel like we needed the same kind. And I know that Andy has taken less credit enhancement in future deals than in that first one. So I think part of the evolution of thinking about pay for success financing is people who do investment for a living learning the language and way of thinking and sort of mode of operating of the civic or social sector, and also vice versa. And probably the first concept, flowing in that direction is the concept of risk-adjusted return. I never thought I'd be sitting on a panel totally defending Goldman Sachs. Told you.
It's that we share the same name.
Good morning. Was there a strong and/or obvious reason why the program in Rikers didn't work? And in crafting the program and using this evidence-based strategy, was there any situational flexibility employed, as we discussed in the earlier panel?
Yeah, it's a great question. And I think as folks were speaking about earlier, a really interesting one when it comes to sort of innovation versus evidence-based programs. This was absolutely an evidence-based program with a ton of research behind it. That said, it had never been tried in a jail setting with this population at the scale in which we were trying it. So there was evidence-based, for sure, huge, but also a lot of innovation and a lot of risk in bringing it into this setting. And I don't think there's a specific element that either of us or any of the folks involved could point to, but it was an incredibly dynamic population and environment in which this program was operating in. And to your question on flexibility along the way, absolutely. And so, through the course of this program, there was a ton of conversation between MDRC, the intermediary, the City of New York, the Department of Corrections, to tweak all along the way to adjust to that environment and to make things work. So just thinking about evaluation, for example, the original goal was the sort of gold standard random control. That was what we all wanted to do. But the reality of a jail environment is that people are moved from one housing unit to another for very valid safety and other reasons. And so we tried it, and there was just no way that it could work, for example. So that was this kind of early adjustment just in thinking about the evaluation. But there was also a lot of adjustment along the way to make sure that these young men who would benefit, or we hoped would benefit from this service, could access it. So everything from the process through which guards get young people from lunch to school. I mean, at that level of detail, to make sure that we could reach as many young people as possible, because the goal was to reach all of them, 16 to 18 years old, in the jail. And we did quite well in reaching them because of all of those adjustments that we had to make along the way. So flexibility is absolutely key.
So I'm going to follow up on the first gentleman's question and then add it to this one, is the time frame. And then there was also a question on Twitter. I've been following people who have been tweeting from Christopher. I don't know if you're around, is are there midterm evaluations as well? And so, and then this goes back to, I want to say it was Pat's conversation from the very early morning about the balancing the time that investors need or want to get paid back and the time it takes to see real social outcomes. So I don't know that I really asked a question, but there's one about midterm evaluations, timing, why was it so short? Does anyone want to take a crack at my random thoughts there?
I'd talk a little bit about the timing on evaluation. We were fortunate to get a Laura and John Arnold Foundation grant to do our startup, and there was actually a report due to them that will serve as an evaluation report of sorts of that ramp-up phase. It's not a pilot. I think it generally gets presented as our pilot, but there was no way for us to pilot our intervention and still be able to start the intervention in a timely fashion. And so I think we have the benefit of having evaluation at certain points as well as throughout the program. And as Russell talked about, our operational committee, we are looking at our data every 2 weeks, and we are scrutinizing it, and we've already done proposed contract negotiation, contract amendment in response to early data. And so I think as an evidence-based intervention, there's less interest in replicating something as it existed in another community, but instead using that evidence throughout your process to make changes and tweaks in the program. Can I say just one more thing? So on the Rikers project, I got to say, as a county employee, as a public employee, I was kind of proud of the decision to bring that program down when it didn't look like it was yielding results. I think there's a tremendous vulnerability that you live within when you're developing a deal, because you know that it'll be scrutinized by everyone, and then while you're in a deal and everybody's watching for the returns, and then to make that decision, to know that, okay, so this isn't working out, let's not carry it forward, just really multiplies that. And so to be able to make a decision to say this isn't working, we tried hard, and let's look at this another way, I think was a very brave thing to do that I have a lot of respect for.
Does Siri have a question? Can I?
Yeah, I was just going to add one thing on the project that we've worked on, and I'm sure Andy has more to add to this as well. I think some of the timeline, right, is absolutely associated with the impact that you desire. And so you mentioned earlier about high school graduation, and it's kind of daunting because you think about, you know, intervening early and then how much time it would be before you knew that it worked. And so when you think about recidivism, there's time there. People need to be incarcerated and then need to not be incarcerated and be out long enough to hopefully not come back into the system, right? And there's just naturally time involved in that. And so in our deal, one of the things that we did build in and what we're talking about from these results is that we would look at 3 years. So 3 years of the program operating would give us the ability, through an independent evaluator, to look at recidivism data 1 year out of jail. The intent of the program ultimately was to go for 4 years, but we agreed that we would stop at 3 years to see if we were on track, and essentially agreed that we would look at the results of that independent evaluation 1 year out of jail and make a decision about whether or not to invest in a 4th year. And so what we're talking about and what Andy spoke about in the results that we received and that we learned from was that we did not see any impact when we looked at that 1 year data, and therefore, you know, as we're speaking about, the city had the information they needed to decide that it didn't make sense for this program to be operating anymore, and it stopped. So it's not quite midpoint, but it was intentionally an early look to make better decisions about the future.
Yes, ma'am. Go ahead, Judy.
I think the only thing I would add to that is, I think to your point around sort of the bravery it takes to do that, particularly on the part of city or county government or state government, that was a conversation we had before the deal got started. And I think that's a very important piece of this, is to have those conversations about what does success look like, what does heading towards success look like, so that you're holding yourselves accountable. Because a lot of this, I think the power in these deals is also about accountability and transparency. And that, I think, is very important.
Yeah, it goes a lot toward the, I think several panelists talked about it. Jeff, I know, was one. Katie was another, about changing the way that governments do business. And you think about that, if that was done with a grant from philanthropy or it was done just through a government contract, there would have never measured whether it was making a difference in these young men's lives. And 2, they never would have shut it down because they had a contract that says you're going to do this into perpetuity, and they don't do zero-based budgeting. They budget by momentum, and so they just fund what they used to fund. And so really changing, and that was a little bit of an overstatement, but but for simplicity's sake, and really to stop doing what's not working is harder than to continue to just do business as usual.
That's right. So it creates a countervailing force to the instinct to keep doing something that's not working. And that's not just about momentum, that's also about things that are real and that we deal with every day, right? The politics of powerful actors in the community that say, like, look, I know this isn't quite working, but give me more time to fix it because I got all these jobs and all these contracts and I'm in your district and whatever else. Those are all real things. And if there's no countervailing force to that, it's pretty easy to just keep going, yeah, let's just keep trying, let's keep working to fix it. But when there's like investors who are losing more and more money every day, neither one always wins, but it at least creates a conversation about, like, do we really think that we can fix this? Is it worth the continued risk of trying to continue to fix? So it creates an alignment of interest that's a little bit different than sort of traditional public contracting.
Hi, my name is Nadira Branch. I am a proposal writer. I am also a social entrepreneur and a Fulbright scholar, so this is my space. I just thank you for allowing me to ask my questions. I have 2 questions, and I don't know if they're necessarily related, but the first question is, after this program ended and you made the decision to end it, what happened next? And my second question is, I'm thinking about the soldiers or heroes, I'm not sure what you call them, who actually provide the service, the direct services to the public. If those employees are, if their jobs are not contingent upon grant funds, then they will most likely continue to be paid, right? But if their jobs are contingent upon the grants to be funded again, then my question is, in that situation, does the focus of how they provide their services to the public change? And have you seen any, are there any observations on how the focus of how direct services are provided when someone's job is contingent upon funding? Is that,
Yep.
I don't know.
Yeah,
clear
no, those are
that way?
good.
Yeah.
So why don't we say what happened after it was shut down, and then I'm probably going to put Russell on the line to talk about the frontline workers.
It really then went back to the city for them to continue to look at what was happening on Rikers, try and use the information they got from this program to figure out what was their next approach for those young people on Rikers. At this point, and maybe Katie has fresher information, our sense is that that is something they are actively working on, and I think certainly very focused on figuring out what is another potential solution, because the recidivism rates and some of the challenges that those young men face, I believed, continue to be a priority. But it then goes back, sort of again coming full circle, it goes back to the city. And they're the ones that are best positioned, along with advocates and community leaders, to really continue to tackle this problem.
Yeah, I think one thing I'll add to that that speaks to really just the learning of this experience, and to the earlier question about sort of tweaking along the way. One of the great learnings from this project for the City of New York is that they could work with a nonprofit provider to bring a new program like this to scale quickly. And a lot of those things that we talked about, or that I spoke about around how do we efficiently transport young people from lunch to a program to make sure they can get the program, all of those little things are real learnings from an operational perspective for the city that now, as Andy mentioned, in their continued commitment to better serve these young people, they know that. And the next program that they're trying doesn't have to go through all of the hurdles that they did on this one. So there's a lot of learning from an operational perspective that we certainly are hopeful will really benefit the city as they move forward to serve these young men.
Russell?
Yeah, that's a really interesting question, by the way. You asked me a question in a way that I hadn't quite thought about. So I'm trying to channel my staff's sort of feeling. But no, I think the first thing I would say is, I think to a T, my staff would tell you they love working in a performance-based environment rather than what we typically have done, a fee-for-service-based environment. And why that is, your typical social worker will be accountable for meeting with someone for 3 hours a day. And that's sort of the way in which they keep their job, is they have provided 3 hours worth of service a day. That can kind of become not so meaningful to people who are really, I think, got into this line of work to make changes, both micro and macro level changes. So when you just realize you're just trying to chase hours every day, that can be, I think, a little bit burnout inducing itself. And it frees them up to be much more creative in what they do, which I think they like too. I have therapists who have to go to staffing sometimes, like DCFS staffings, where they're at team meetings because maybe a case manager's out. That's for the good of the project. We all understand that. And they enjoy that, actually, being in that staffing and advocating on behalf of that client. It's not necessarily what their job title is, but it's contributing to the common good. So I'd say, and I also would say to that I have staff who work in fee-for-service projects who are always asking if I have openings. So I think that speaks to one thing. But I won't lie to you, it's stressful for all of us. And I think the stress isn't necessarily bad, though, right? It depends on how you kind of stress is motivating. So I would argue that my staff are really very aware of the outcomes. We talk about them in meetings every week and individually every week. They're aware of their own individual outcomes, how they relate to the team outcomes, and how that sort of relates to the overall program outcomes. So I think it makes them somewhat stressed, myself too, to make sure that we're doing a good work. We're trying to be as efficient and impactful as possible. because we all understand our jobs on the line. More than that, though, I'd say, and fortunately, I think we all got into this project at my agency because we want macro level change. You know, it's if we lose our job in the process because we learned something new, we see that as a benefit. Hopefully that doesn't happen, you know, knock on wood a lot right now. And we feel like we're on a good trend. But to say like we got into this to try and create change for a population that we feel like is significantly discriminated against. And that doesn't sit well with any of us. So I think it's really a moral motivation, even more than an outcome motivation, though of course they're related.
I think there's a flip side to this too, which is that when you're paying for performance, you're willing to pay for performance, right? Whereas when you're paying fee for service, your goal is to get the most service for the least fee, right? So in real terms, what that means when governments are contracting is that one way to win the job is to be the nonprofit that comes in with the low bid, right? Which means when you take that down to the ground level, I'm gonna try to find the social worker who will do 3 hours cheapest. I don't think any of us think that's the way to find the best, most dedicated, most experienced, most qualified social worker, right? It's just not. And one of the things that Russell said to us and his team said to us when we were underwriting the deal is that one of the values of Pay for Success for them is that the people who are fronting the money, the investors, are actually saying, don't tell me how cheaply you can do this, tell me how cheaply you can do this well, right? And I'm not under that sort of set of almost arbitrary constraints of what things need to cost per hour. I'm able to actually budget for what I think works. There are also incentives to keep costs down, and those are built in too, because you don't want to create a framework where it's like a free-for-all for spending, and there are ways to do that. But I think one of the values of pay for performance is that it really does create this incentive to try to figure out what it costs to do something well.
Yeah, I think that goes to a study that Nonprofit Finance has done, and it was quoted at the White House where I was last week, and I'm gonna get the numbers wrong, but it's some horrible percent of nonprofits who do government contract work are significantly underpaid for the cost of providing that service. And I want to say 82%, and Bill, you can correct me, though I won't put you on the spot to know your data.
I have every fact data point.
So,
I'm going to go with 80.
So 82% of nonprofits don't get the full cost of providing the service through their government contracts and have to raise additional money from philanthropy. And that's not the way to get good service. Yes, ma'am.
Hi, my name is Katie Martin. I'm with Pew Charitable Trusts. And I think one thing everybody in this room can agree on is that these are extremely complex financial instruments with many stakeholders and interested parties. But at the end of the day, I think there's a still fairly limited number of people served. So if I'm wrong, correct me, but I think Cuyahoga County is 135 families. In Salt Lake City is 600 3- and 4-year-olds. And so as people who are on the ground, I'm just wondering, from your experience, what are the barriers or the opportunities to moving from hundreds served to thousands or tens of thousands? Because that's really the scale that government needs to work on.
I can start if you guys don't mind, and it doesn't matter if you mind. I'm the moderator. I think one thing that's exciting that will help the scale is getting the federal government involved. I come from the housing world, and so I equate a lot of pay for success to what Ian talked about. The community development world has been doing this forever. The way we got to scale, not scale enough, but to scale on affordable housing was when the federal government created the low-income housing tax credit. There was a predictable source of financing to pay for housing. That's going to be a way to get to scale, and so that $300 million from the federal government is step one. The 10% of WIOA funds to allow for paying for outcomes is another step. So I think that's one of the barriers. And then the belief that every single community is different has to change. Cities are fundamentally the same organisms. Like people, 98% of their DNA is exactly the same. It's the 2% difference that we all see and we all focus on. And we need to get over but we're not New Orleans, but we're not San Francisco, we're not, we want to improve the lives of low-income people. And we need to recognize the ability to replicate what's already been done in other places. So I think those are two of the places that we need to get to scale. But
if I could add just on our projects as it relates to scale, there's a balance here between scale and intensity. And I think when we started with our project, we did a data integration between our child welfare data, our jail data, and our homeless service data. The first time we brought all three sources together. And we initially thought there would be hundreds of families that'd be served by this program. But as we moved through the model, we actually saw that number dwindle because many of the families were not reunifiable. They were laid into their custody, or their children would never go home. Or the children were dependency cases where the issues were with the children, and our intervention didn't target that. So I think what we did land on, though, is a population that had very intense needs, and it would be definitely a generalization for me to apply an 80-20 principle here, but 20% of the population is using 80% of the resources because of the intensity of their needs. And for us, this is an expensive intervention. It's a modest project, right? $4 million is modest by other deals' perspectives, but it is still a very, very high need group that will most likely be served by the county for the rest of their life if we don't get it right. And so we felt like we had actually a good scale point of having enough families come through our system that we would make a very significant difference because they had needs that would ultimately extend our service relationship probably through the rest of their lives. And doing an RCT will enable us, if this is successful, and I really believe it will be, to be serving the 90 families, 100 families a year moving forward after we prove our success.
Anyone else? That's a great question, though.
The nonprofit B-Lab. I was wondering, many of these issues are systemic and have a lot of causes and therefore require a systemic solution. As the space matures, has there been any thought in investing in a network of service providers and interventions to minimize risk and enhance performance?
From our perspective, we think that's an interesting approach. And it really is going to depend on essentially the ecosystem in a given community and, of course, the challenge. And I think to echo Katie's point earlier, it's early days in these, and I think there's a lot of room for that kind of creativity in terms of problem solving.
And in San Francisco, they're actually playing with that very idea. They're very early, and it will absolutely take the 3 years that David talked about in Cuyahoga because it is so nascent.
I'm John Melvin from Sidney Kimmel Medical School. I have a question related to evaluating whether or not the evidence base of certain studies are relevant to the circumstances under which the investment project is going to occur, because sometimes it's difficult to really put evidence base in the studies that were sort of idealized into the real world.
Should we punt that one to John Roman? You're the evaluator in the group, or your organization is.
Yeah. I could take it a little bit. I wish our partners from MDRC were here because they could absolutely answer your question better than I can. But one of the things that was actually really great about our partnership with MDRC as the intermediary was their incredible knowledge of evaluation and their expertise. And so, as I mentioned, the intervention that was chosen for Rikers had a significant evidence base behind it, not in a jail setting with young people, but in prison populations, primarily in prison populations, I think in some substance abuse programs. There were sort of analogous settings, and as you probably know, there are many different kinds of cognitive behavioral therapy. The therapy that was chosen was specifically chosen because on its face, it appeared that it could operate best in a very dynamic environment. So it was a group therapy in which it totally makes sense and is good if the group is changing over time, which is something that would work well on Rikers. It was a program in which the group would benefit from some folks being further along in their steps than others. So there were definitely, we considered all of that with a lot of expertise from MDRC, but it was still a unique situation.
I can speak a little bit to that too. We had some challenges with sort of fitting evidence-based practices that we had experience with as an agency to this particular project. Just as an example, we use critical time intervention, which is an evidence-based practice which has been demonstrated to be effective in a number of studies with particularly adults, singles who are transitioning from homelessness to housing, and typically when there's a severe mental health issue on board. There had been some research to support its efficacy with families, but not a strong evidence base in that way. We had experience internally at the agency using critical time intervention. We had been doing program evaluation and also had external analysis on that particular project, so we had experience in-house. But we had to sort of talk to experts in the field, think about how that particular intervention is going to apply in a slightly different setting. First of all, a different community, but also there's not only the housing piece, but the critical time intervention case managers are focusing on the case plan a lot and trying to help the moms and dads adhere to the case plan if they want to reunify so they can get children back. So, we looked at all of the research, sort of synthesized that, talked to all the parties involved about that intervention, and we're transparent around it hasn't been used in this way yet. Though these are some reasons why we think it will be effective, and we've also used it internally so we have a knowledge base at the agency about that. But you're right, there was some sort of force fitting there.
If I could add to that, I think Bill and Jeff brought up the concept of should pay for success be used to scale existing programs or to be seeding interventions that are innovative. And I think the way that we managed that was to have many conversations. We reached out to Corporation for Supportive Housing and had, Andy gave us a lot of support. We reached out to Harvard Kennedy School. One of our technical assistance providers, Leah Schuster, she's sitting up here to your left, she was with Third Sector Capital Partners, and they due diligenced this to such a level that we have never gone through as a program. I mean, they ripped it apart and said, how would you answer this? How would you answer this? And that is not what government does. We release an RFP, lowest and best wins. We don't tear apart an assumption to get to how will this actually work. And at that point, once you feel that you have a strong kernel there, you have to have those conversations. You have to reach out and feel comfortable saying, and again, this is the vulnerability point, I don't have the answers. Is this going to work? And I do want to go back to, I think, Ms. Branch's question just very quickly. The other thing that we did is we had staff that were in the field help us design this program on the porches of the clients that they would be serving. And I mean, this was something that, I talked about this program taking 3 years to develop. It was probably more like 60 years of staff time. These are leaders within the community that go out and knock on doors when a family's experienced a violent death. And what's the reaction and what's the outcome to that situation? So this came together over 3 years, but we had 60 years of staff time into coming up with an intervention that's not driven by compliance to a federal fund, that's not driven by an artificial timeline, but by a government saying, here's the thing we want, what would get us there, and provider, how would you deliver that? And then that opened a conversation that evolved once funders joined the table and said, how would this work?
Can I give it to somebody who hasn't had it?
I'm Dana from Nonprofit Finance Fund. I have a question about this whole idea of risk-adjusted return, and it strikes me that there's a lot of variation in how different investors are going to understand risk and where they're going to see the risk in a project. And I think the point that Jeff made earlier about every project has some level of innovation in it, whether that's just the actual, how are we going to get people into the seats in the workforce development training, and who's going to make that referral, and where's the handoff going to be to these much bigger risks of, do we actually know, we don't really know how well this service works, this intervention works. And so I'm just curious on your thoughts for the investors that have been in more than one project. What's the mechanism that you've seen by which risk is or is not adjusted, and how do we move towards any kind of, is there a way to move to any way of standardizing the risk from deal to deal or from investor type to investor type?
You want to go first? I'll go second?
Okay. Yeah. You'll do clean up. Again, correct me if you want. I think it's a great question. And I think that, again, let's keep in mind there have been 8 deals done in the U.S. market. The total market size is roughly $80 million. And so while I think we hold ourselves accountable to risk-adjusted returns, and I think Andy does as well, unlike, to use Eileen's example in the affordable housing space where we have 30 years of history to understand that, we don't have that history yet in this market. And so it really is about looking, for us, we're looking at individual deals on their merits. We look at the track record of the groups in achieving the impacts that have been laid out and the outcomes that have been laid out in the Pay for Success contract. We use published research data when that's available. We use operational data when we can get access to that, and really spend a lot of time saying, will this intervention produce the outcomes and the impact that it's setting out to produce? We also then think about who are the team of people that are delivering it. Based on Russell, I would invest in him any day of the week. That's what you're looking for, is great managers, organizations that have great performance management, something that you look for in any investment. We also, you also within these deals have to think about the contract. And 5 years from now, even if we've hit the outcomes, is that government going to honor that contract? And again, that's just another piece of the risk. So we spend a lot of time looking at each deal individually and then make our best assessment. But I think it's really early days to say, well, there's a systematic way to think about it. But I would also agree with what Andy said earlier, which is we're heading in the right direction, right? So Andy, off to you.
Generally that. If you want to, Eileen and I a couple months ago wrote a blog about the P's of Pay for Success, and it was just about how we approach assessing risk as investors. And it says a lot of the same things that Andy just said, but if you want to read it, it's out there. So that we assess risk in very much the same way. But I think more broadly, this is how financial markets work, right? Different investors assess risk differently and have different appetites for risk-adjusted return, right? A nonprofit like the Reinvestment Fund is going to be willing to accept more risk for less return than, a hedge fund in most instances, right? We just are. We have different objectives. But that's what financial markets are for. They're about matching people who need capital with people who think that the risk-adjusted return of that need is right. So the greater the diversification of investors and their sets of interests and their ways of assessing risk and their need for return in the space there are, the better, because that will allow better and better and sort of more finely tuned matchups. And that's kind of the value of having a marketplace for something.
Yeah. I think Andy and I can talk about this for hours, so we'll move on. So we have 1 minute left. Fast, quick fire, is that what you guys called it in the last panel?
Is this going to be a surprise question?
Yeah, it is. Yeah. Knowing what you know now, would you do it again?
Absolutely.
Of course.
Yes.
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 Okay.
And have done.
I just wanted to thank our panel. And Teresa mentioned this morning that we are live streaming the event. So for those of us joining us online, we are going to pause until after lunch when we'll have our keynote speaker at 12:30. But for those of you in the room, we want to continue hearing from you. So I'm going to turn it over to Gavin Kerr, President and CEO of Inglis, who was a great partner in planning this event, who will walk us through the small group discussions. But for those of you online, we will be taking questions from Twitter later in the day. So #PFSPhilly if you want to ask a question later. Gavin?
Good afternoon, and Eileen, I think there's some presidential debates that are looking for facilitators. You really do it well. You could maybe do that, The View, one of those programs. You'd be in good shape. So first, I want to thank everyone for coming here. One of the things that I believe is happening is we're at a major change point as a society. And we have enormous challenges. We have ever more constrained resources.
All right, while everyone is finishing their lunches, I just ask if you could take a seat. We're going to get started back up. Oh, I have it for you. All right, so welcome back to those of you joining us on the live stream. We took the time while we broke to have lunch, but also have small group discussions about some of the questions and comments that have been surfacing at our tables. We also invite you to participate through Twitter, so if you have questions for our facilitated discussion that will happen next, after our keynote speaker, you can send those questions to #PFSPhilly. But right now, I am pleased to introduce our keynote speaker, David Wilkinson, Director of the Office of Social Innovation and Civic Participation at the White House. David leads White House efforts to identify and scale better, more effective social solutions, advancing presidential priorities that strengthen communities and enable upward economic mobility. Before his role at the White House, he served as Executive Director of City First Enterprises and co-founded and helped lead a successful effort to launch the Startup Community Development Bank in New Haven, Connecticut. He also served as Executive Director of Common Cause New Jersey and has served as a founding director of City First Foundation. He was selected by Next American City Quarterly magazine as a member of its Next American Vanguard, an annual 40 Under 40 award honoring urban innovators. He was also a Jane Addams Fellow at Indiana University's Lilly Family School on Philanthropy. David is a graduate of Yale Law School and University of Virginia. Thank you, David, for joining us today, and please join me in welcoming David Wilkinson.
So I think that we all owe Noelle a round of applause. She came up right at 12:30. I've seen the agenda. You've had 15, 17 speakers, and right at 12:30, which is when we're supposed to start, is when we started. And that is a feat that we don't often see at the White House. So excellent. Well, I am very glad to be here with you today talking about my favorite topic. I'm a big fan of the Federal Reserve. I was telling Teresa that I was excited. First of all, I'm thrilled to be in this wonderful facility, but I was excited to visit the Philadelphia Bank, the Federal Reserve Bank of Philadelphia. I have been to 7 banks to date. This would have been the 8th, and I'm trying to collect them all. So I hope that they'll invite me back another time. So I am the director of the White House Office of Social Innovation, which is an office that the president started to take on sticky challenges and bring new innovative solutions. We're a policy horizontal among policy verticals in the White House. So typically you'll see policy verticals covering labor, education, immigration, etc. We focus on a series of what we call horizontal issues. And for us, that's national service, impact investing, philanthropy, the nonprofit sector. And our broader agenda is to help create a more outcomes-driven social sector. So that's our focus. And we've made good progress. I like to bring props. And so 2 books have come out on the Obama administration's progress in advancing the innovation and evidence agenda. And events like this show that it's not just us. It's partners around the country, in local communities. It's national thought leaders, nonprofits. I know the Urban Institute is here. It's the Federal Reserve. It's so many more that are really helping to advance new ways of thinking and tackling in a cross-silo, evidence-driven way the challenges that are facing our communities. But before I get too much into the challenges, and I will, it's worth noting that I'm coming to you from a White House that is feeling pretty good. We have about 1/3 of a presidential term left to go. We are sprinting to the finish line. We've got so much more to do. And we feel happy that we've accomplished a lot. We are looking forward to the jobs report that's going to be coming out this week. Last month's jobs report marked the 67th consecutive month of job growth. That is the longest continuous streak of job growth since we've been tracking job growth on a monthly basis in the United States. We have gotten unemployment down to 5.1%. We've created 865,000 manufacturing jobs since 2010. Factories are opening at the fastest pace they have in 20 years. Foreign direct investment in manufacturing has doubled in the last 12 months alone. Gas prices are down, consumer confidence is up, inflation is low, and we have reduced the budget deficit by 75% since we came into office. So we're feeling good about macroeconomic indicators. And we're also seeing good progress on social indicators. Teen pregnancy is down. We've reduced veterans' homelessness during this administration by 1/3. That's a level of progress that most people wouldn't think possible. Incarceration is down, and the president made a series of announcements just 2 days ago in Newark, just up the road, announcing a series of new commitments to help ensure that populations who have served their time stay out of prison, including a new Pay for Success grant competition out of HUD and the Department of Justice. So I'll talk a little bit more about that. So we're happy. There's a number of, you may have noticed that we speak a decent amount about healthcare in this administration. So we're happy with our progress there as well. We had a couple of technical glitches, just as I did with my PowerPoint presentation. That comes with the business. But 13 million more people have health insurance because of ACA, because of Obamacare. And that's a real accomplishment that we're proud of. Thank you. And here's a statistic I think that hasn't crossed enough radars, which is that high school graduation rates are the highest they have ever been in the United States. And that is true across every demographic group. So we're proud. There's a number of accomplishments that we have seen, and we are continuing to push for more, and with good reason. I named a number of good statistics. Here's a statistic that is less comfortable and more troubling, which is that still in this nation, about 20% of children are born into poverty. And their life outcomes are going to be worse across every metric due to no action of their own. Statistics tell us their life outcomes are going to be worse. They will be less prepared for kindergarten. They will be more likely to endure child abuse and neglect. They will be less healthy, more likely to experience childhood chronic disease, from obesity to childhood asthma, chronic asthma. They will be less likely, or they'll be more likely to be suspended from school, more likely to experience teen pregnancy, less likely to graduate from high school, more likely to spend time in their life unemployed, more likely to become incarcerated, will have lower lifetime earnings, and as they get older, they will be more likely to experience chronic disease. So that's a challenge that we're still working on. The persistent challenges of poverty are very much still with us, and we know that the people in this room are tackling that challenge in new and creative ways. There's no higher priority for the president than to continue to seek to move the needle in every way we can to take on that challenge, to create new ladders of economic opportunity, to help create stable lives so that people can avail themselves of those ladders, and to advance upward economic mobility. And the president knows that doing things the way we've always done isn't incredibly likely to get us different results. And that's the reason he launched the White House Office of Social Innovation. It's the reason we've launched place-based initiatives, from Promise Zones to the My Brother's Keeper Community Challenge. It's the reason that it is a driving reason for ACA. and so many other policy priorities where we've really made progress. So we know we need innovative solutions. We have made progress on the social innovation agenda, and pay for success, we think, is a big part of that, and a promising part of that. Pay for success we see both as a tool to help overcome barriers to the solutions that we know are working best, as well as a tool to help communities try new things that they may not otherwise be willing or able to do. And so I'd like to share with you a couple of things. One, why pay for success is such a priority. Why was pay for success part of a presidential announcement both on Monday of this week and Tuesday of this week? We're pretty excited about that. He has been talking about it increasingly, and it is the centerpiece of the President's social innovation agenda. So we'll talk about that, and then I'll share how Pay for Success fits into the broader social innovation agenda, of which many of you are a part, one way or the other, whether you know it or not. So I think it's good to start in place. So why don't we all go to Denver, though the weather's pretty nice today in Philadelphia. So Denver is interested and presently working on expanding a solution that is incredibly evidence-based, permanent supportive housing. How many people know what permanent supportive housing is? Virtually everyone. Okay, that's good. Evidence-based solution, we know it works well, we know it generates better results, we know it saves resources. I was meeting not too long ago with the chief of staff of the governor of Oregon, who was in Portland before that, and said, yeah, we were told that we save so much money on permanent supportive housing, and so we invested big time in it in Portland. But the thing is, it didn't save money to the city of Portland, it saved money to the health system, it saved money to the county criminal justice system, and a number of other places. It saved some money to the city of Houston, city of Portland. So Denver is looking at this and is looking at this from sort of a different perspective. And so first of all, they did some math. They were interested in applying the solution of permanent supportive housing for a population of 300 chronically homeless individuals. And they found, by using administrative data, one of our favorite things, they looked at this population, which are super utilizers across systems. They're heavy users of the criminal justice system. They're often cycling in and out of jail. They're heavy users of the healthcare system and emergency rooms. They're in and out of rehab, in and out of shelter systems. And so Denver linked data across these systems, and they found this population of 300 individuals was costing, across those systems, $11.4 million a year. And they said, okay, well, how much would it cost to provide permanent supportive housing to this population? $5.4 million a year. So Denver concluded that they could effectively end chronic homelessness for this population and save $6 million a year. But there's the Portland challenge. How do we figure out how to cross all of those systems so that each system can pay its fair share, and so no system is free riding on the other? How do we solve that wrong pockets problem? And there's upfront costs at the same time as you're delivering on current services. So Denver said, what if we could pay for these results that we are highly confident will happen? What if we could pay for them after they've been achieved? Government is incredibly used to, in Denver, paying for services once they're rendered, less used to doing that in the social sector. And so what Denver has decided to do is to pursue this through Pay for Success. And we expect that transaction to close sometime early next year, first half of next year. Oh, that's good. Andy from CSH knows this much better than I do. Thank you. So if it's in January, we'll look forward to shining a spotlight on that. So they decided to do this through Pay for Success. It made sense for them to advance an at-scale preventive solution through the tool of Pay for Success. And so why do we think this is important, the notion of paying for outcomes? So I think there's a lot of complicated definitions of pay for success that don't need to be that complicated. So here's the White House's definition of pay for success. And that should be I was just presenting, sorry for that PFP there. There's new legislation, the Workforce Innovation Opportunity Act, that calls pay for success pay for performance, which is why it says PFP. Definition is the same. Pay for success is performance contracting, where performance is rigorously verified social outcomes. That's all it is. And so, again, we know government is used to paying for performance. Government pays for performance all the time when we buy vehicle fleets, when we buy services like recycling or trash pickup, so much more. Even in the case of infrastructure, we're accustomed to now paying for performance, paying for the outcome that we want to see. But in the social sector, we're much less experienced at that. We are much more likely in the social sector to pay for outputs and compliance as opposed to outcomes and impact. And that is a problem because social service providers are out there doing hard work, and they spend a lot of time engaging in compliance, distracted from the outcomes that we would like to see them achieve and that they would like to achieve. And so if we can better align outcomes, it stands to reason that we will achieve better outcomes. So I think that it's worth noting that addressing this problem is at the center of the social innovation agenda. We believe that where there is evidence that programs are achieving the outcomes that we want to see, that are determined by rigorous analysis to be outperforming the status quo, then government should act by replicating and adapting and scaling those problems. And we have some good news. We know that there are interventions across issue areas, from workforce training, early education, childhood, asthma, substance abuse, homelessness I mentioned, across issue areas that are achieving consistently measurable, better results. And that's an exciting thing. So I'll give a few examples. Many folks know about the power and potential of nurse home visiting or home visiting solutions. Multiple randomized controlled trials, other studies. We know that moms are likely to have better health behaviors during pregnancy and early motherhood, and that children's outcomes are much better. Infant mortality is 60% less for children that receive these sorts of interventions. Children are 39% less likely to have language delay, 46% less likely to be involved with crime later in life. These are the type of needle-moving solutions that we hope to see that can take on the challenge that I mentioned earlier, 20% of children born into poverty. So what are the solutions that we can deliver? Nurse home visiting is one. Multi-systemic therapy is another very well-proven intervention. Kids, at-risk youth who receive this intervention are 64% less likely to be arrested for drugs, 57% less likely to go to jail, 43 fewer days on probation. And time and again, this intervention is proving that it works better than business as usual and is getting better results for kids and for the communities they live in. And this is one of my favorites. Veterans who have served our country have incredibly high rates of PTSD. And we know that vets with PTSD have very high rates of unemployment. The VA has systems that support vets with PTSD to get connected to the job market, to provide those services. But they're only successful 28% of the time. But we know there's an intervention called individualized placement support that has 22 randomized control trials, including one exclusively on veterans with PTSD, that's consistently placing them in jobs 76% of the time. 76%. So that's almost 3 times better than business as usual. And they're also earning more money. But if you're a veteran today with PTSD and you're seeking help, you're unemployed, you're seeking help, you will almost definitely get the 28% solution, and you will almost definitely not get the 76% solution. And so that is part of the bad news, which is while we know there's multiple interventions that are consistently outperforming the status quo, too often they're staying on the shelf. They're not being deployed. Notwithstanding the fact we know we're getting better results, and that many of these solutions are preventive solutions that are also saving money to remedial services. So we're very interested in why that happens. Why aren't cities and states and even the federal government implementing the solutions that are consistently working better? And so we think there's a couple of key reasons for that. One is that budgets are stretched. It's very hard to find money for preventive solutions when your safety net budgets are maxed out. We may have evidence that a mix of cognitive behavioral therapy and job training reduces the likelihood of recidivism, but it's very hard to find that money. We know that it may cost $80,000 a year to imprison a person, and that the intervention that I just mentioned might cost $10,000 a year. And so it's an investment that a private market investor would make day in and day out every day if they knew they could get that kind of return. But government budgeting often doesn't work that way. So one challenge is that budgets are stretched thin. Pay for success is a promising solution because it helps address that challenge. In particular, government, through Pay for Success, pays for the results once they've been achieved. So when we're talking about interventions that have offsetting savings, that means government can take a portion of the savings that it enjoys after an intervention is successful and use it to pay for the intervention. So that's a promising solution. It's not going to work every time, but it's often the case for Pay for Success. And we think the solutions where Pay for Success is enabling money-saving preventive interventions is sort of the thin end of the wedge to begin to scale the solution up. This picture is happening to do double duty because it also stands for the wrong pockets problem. Sean Donovan is our budget director, and he was formerly the Secretary of HUD. And when he was Secretary of HUD, he was fond of saying that for every $1 million he invests in clinic space through HUD budget, he saves $6 million to the Medicare and Medicaid budget. But he has very little incentive to deploy HUD resources on medical space. And for its part, Medicaid has little authority to deploy resources to build out space at all. Now, we're working on those things, but the broader point is there's this wrong pockets problem. Sean, then Secretary Donovan, could decide if he wanted Medicaid to free ride on his much smaller budget, and that's a tough decision to make when you have a number of other mandates. And so that is a big challenge. But there's another challenge, and that is that there are stakeholders in the status quo. And when we're talking about implementing some of these innovative solutions, these proven but innovative solutions, it means changing from the way things are today to something new. And you can bet that if you're a mayor or you're an agency head and you're thinking of implementing something new, one of the things you're thinking about is, what if it fails? I know it's worked before, but what if it fails that time? There's a lot of people waiting to point out that it didn't work. And so it's often easier and safer to leave well enough alone, rather than try to cut through all of this. So the concern is that it will fail, constituents will get mad, and so politicians are scared. There's another challenge as well, which is that there are a number of, when we are brave enough to adopt new programs, innovative programs, so when we are brave, elected leaders and others, and start something new, one of our challenges is that the programs become immortal. We never bother to study whether or not they work. So Pay for Success And because we don't bother to study whether or not they work, we tend to scale them, and they get the same stakeholders, et cetera. I've heard a number of people say it was the best thing that could possibly happen at Rikers Island that the intervention didn't work, because it proved that the pay-for-success model did. The government did not pay for outcomes when they weren't achieved. We were able to learn. We were able to build an evidence base. And that intervention that didn't work as delivered in that setting won't continue to deliver null result over time. And that is one of the most important and valuable things pay-for-success can do, is prevent programs from becoming immortal if they're not delivering results, not doing right by the people we're seeking to serve. So there's a number of charts about pay-for-success. Many of them put the investor on top. I don't like the ones that put the investor on top. I think it obscures the broader point. So I'm going to do two quick charts of how we see pay-for-success at the White House. So first, you need a government payor, or another payor. Could be an insurance company, could be a philanthropy, could be others. You need a payor, and they say, I'll pay for outcomes. And the service provider indicates that they'll try. The government makes a promise to pay for outcomes when they're achieved, delivers the intervention, an independent evaluator evaluates the intervention to ensure that it worked. Guess what, guys? Good news, this time it did, as you can see by that green check. And the government makes the payment. That's pay for success. Now, people often conflate pay for success contracting with pay for success financing, which is also often referred to as social impact bonds. And we think it's important to distinguish those two. Now, it's often the case, and so now we'll look at, well, I should also, before I do, if the intervention, this is sad news, in this case, this intervention didn't work, and so the government doesn't pay. Okay, so now we'll go into pay for success financing. So here's how pay for success financing works. It's one part, one element of what will be many, but not all, pay for success contracts. And it involves an extra party. So in this case, the government makes a promise to the investor. It says, I'll pay for outcomes. The investor says, we know that the service provider in this case may have the capacity to deliver the intervention, but it may not have the balance sheet, the resources to deliver the intervention, wait for the outcomes and the evaluation, and then get paid. That's why pay for success financing, or what's referred to as social impact bonds, is often valuable. So in this case, we need impact investors, mission investors, who'll say, I'll make a bet. I'll make a bet that this intervention works. And if it does, I get paid back. If it doesn't, I take the risk. And then it works much the same. Service provider delivers the intervention, evaluator evaluates it. If it affirms that it works, then instead of paying the service provider, government pays back investors. And you can imagine all sorts of iterations on this model, and we expect that there'll be iterations on this model. And of course, if it doesn't work, the investor takes the hit in this model rather than the service provider. So we're very enthusiastic about this model because it helps overcome these barriers to the interventions that we want to see. Nurse home visiting is a terrific example where we ask every year for Congress to triple the budget for that highly evidence-based intervention that's delivering better results, and every year we end up fighting just to keep the same low levels of funding that we have. Pay for success, as an example, we see as a tool to help communities scale up that intervention. So how can government and philanthropy help? I'm most focused on how government can help, in particular from the federal level. Well, here's how we're helping. One is we're helping with feasibility studies. Communities need to determine if pay for success works for them. Sometimes they're interested in replicating and growing a particular intervention. Sometimes they're interested in the model and need help identifying what type of intervention fits for their community for pay for success. We are providing robust funding through the Social Innovation Fund to scale up pay for success and to build the pipeline of viable transactions. Another area is deal structuring. So deal structuring is what happens after the community does the feasibility study and decides, yes, we want to move ahead. We want to take on Pay for Success. I know in the back of the room there's a social finance City of Philadelphia feasibility study, and I have a copy of it in my bag, so I'm excited to take it home and read it. But that leads to the next step, which is let's go ahead and do this thing. So I hope that the City of Philadelphia will. Transaction structuring involves bringing together all of the parties. The investor, the evaluator, the service provider, the city, getting them all to the table, negotiating it through to closing and launching the program. And so our Social Innovation Fund dollars are doing that. There's some other things that we can do as well. We can provide direct project funding from state, local, and federal government and from philanthropy. An overly simple example, imagine a $19 million transaction that has a gap. We could provide grant funding to that, or we could provide credit enhancement to help attract the extra financing, or we could invest directly ourselves as government or as philanthropy. And the last way that we can help, sort of the brass ring, if you will, is we can be paying for outcomes. And it's hard for government procurement officers to get their heads around that. And we see Pay for Success as a tool to do that in a way that is discreet and within the context and confines of a contract, so it can help them think creatively in a more narrowly honed way. So paying for outcomes. And we've done that with the Department of Labor in Massachusetts and in New York State. What's very exciting about the transaction, about the grant program that was part of the presidential announcement on Monday in Newark is, well, it's from HUD and the Department of Justice, and it is going to do every single one of these. So it is the coolest Pay for Success grant program the federal government has ever put out. It will fund feasibility, deal structuring. It will provide direct project funding in the form of funding to cover the costs of evaluation, and the dollars can fund outcomes as well. So we're very excited about that, and we hope it's a model for future government Pay for Success subsidy models. But let's take a step back for a moment to put Pay for Success in context. So we have some key objectives for government innovation, and Pay for Success is relevant to every single one of them. One is government needs to be able to be responsibly experimental. Government has a tendency, certainly the federal government, to need to act at a relatively grand scale. And so when we experiment, we often do it in a way, or we can do it in a way, that might not always lead to the best results for the largest population. I think of the 1950s, 60s, 70s. We thought that the best way to address urban blight was to tear down communities, fine-grained townhomes, et cetera, and replace them with high-density Corbusier-style high-rises. Well, that failed. And that was a really big government experiment on a lot of people who could least afford to be experimented on at that level. That didn't work well. But government can't be in a position where it can't innovate and continue to address societal challenges. And we, as I mentioned, we're often scared of trying new things. Government needs to be able to experiment, and Pay for Success is a way to do smaller scale tests of promising solutions. And if it works and continually works, then it will make sense for government to scale it up. We do not think that Pay for Success is the permanent solution and the way government should continuously fund necessarily all programs. It may be that government decides, after paying Goldman Sachs or CSH or other investors a rate of return, that it would, since the program is working, it would like to pay for it itself. And we think that that's a terrific outcome. But experimenting is something we need to be able to do, and Pay for Success helps. We need to replicate and adapt the programs that are working as well in terms of some of the interventions that I mentioned before. Pay for Success helps with that. We need to contribute to the evidence base. We need to be continually learning and understanding what's working, where, and for whom. We know that every solution won't work for every community, and we know that there needs to be continuous learning. The great thing about Pay for Success is that government only pays when outcomes are rigorously verified, which means that almost by happenstance of this contractual mechanism, we're automatically contributing to the evidence base, which is a powerful and exciting thing, that this contractual mechanism helps us continuously learn. We need to cross silos. I'm very enthusiastic about the potential of Pay for Success to do this. On Tuesday, folks may or may not be aware of this, the president authorized a new executive order around environmental conservation. And it included Pay for Success as a high priority, high opportunity solution. And so I'll take one example that I'm particularly excited about. Forest fire is an incredibly challenging problem in the arid West, and we expect it to only become a bigger problem. And we know that forest fire is costly to a number of different entities. It's costly to the U.S. Forest Service, who puts these things out. It's costly to water utilities that depend on groundwater, and electric utilities, especially in the West, that depend on hydroelectric power, and insurance companies. And we know that there's an intervention that works incredibly well to make catastrophic forest fire almost impossible, reduces the likelihood of catastrophic forest fire by 99%. So that's a great outcome if we can get forests into that state. That solution is basically a form of brush clearing, and for every $1 it costs to deliver that intervention, we generate 30 cents worth of material. You turn that into pulp, and it can be used for other things. So it wouldn't be a very good business proposition to just go and do that. And it's not worth it alone to the water utility or to the insurance company or the U.S. Forest Service to pay for that individually. But if each of those beneficiaries of this intervention, insurance companies, U.S. Forest Service, water utilities, and electric utilities, can combine, the value proposition is worth about 30 cents on the dollar for each of them. Combine that with the revenue, and this more than pays for itself. So we're enthusiastic about the mechanism of the Pay for Success contract to enable multiple payors to come together. It's difficult for Medicaid right now to pay for economic and social interventions, but it's easier to imagine a possibility of Medicaid paying for the health outcomes that result, for instance, from remediation of homes where children have asthma. And then again, another objective is to pay for outcomes where we can. So in the time that I have left, I think that it's worth noting that we're in a very communications-driven White House and federal government. And when one talks about exciting things like procurement reform and evidence-based policy, people's eyes roll back in their head very quickly. And so we also need to keep our eyes on the prize. And one way that we keep our eye on the prize is to look at the numbers and the big picture potential of adopting evidence-based programs, using tools like Pay for Success to do it. And so let's start with a big number, $800 billion. $800 billion is about the most conservative estimate you'll get of total federal, state, local social services discretionary spending. And so if you've never seen $800 billion before in person, that's what it looks like. And of course, we spend that across issue areas. Early education, K through 12, child welfare, housing, homelessness, chronic disease management, workforce training, etc. And the only reason we spend money on these issue areas is to achieve better outcomes. And so we're getting outcomes for the resources that we're spending. And if you don't see it, at the very bottom, there's a little line. We are achieving outcomes. The challenge is we don't know what outcomes we're achieving because we don't typically bother to track what they are. President Obama's first budget director, Peter Orszag, says that we have evidence of outcomes for about 1% of federal social spending. Now, we quibble with that number. We think it's substantially higher, maybe a few times higher, but even if it's a few times higher, it's not that high. And so we know exactly what we're spending, we know exactly what we're spending it on, and we don't know what we're getting. And so that is a tough challenge. We know a few other things. We know that we're not meeting current need. I mentioned before the impact and the outcome likelihood for children who are born into poverty. You could name many other statistics. We're not meeting current need. Another thing we know is that we're not likely to spend much more. Some folks may have noticed that we've got a new budget deal, and it's a huge political victory that we have a 1% increase in federal discretionary spending. So when we think about how we're likely to move the needle, the notion of significantly increasing federal discretionary spending may not be our best bet. So what happens is we're working with this $800 billion. The number isn't likely to significantly go up. We're working with $800 billion, and that is what mathematicians might call a fixed set. So when we want to fund a new program in state houses, mayor's offices, federal government, it can sometimes be, I heard a governor refer to this as an exercise in robbing Peter to pay Paul. We need to take, since we have a fixed amount of money, we need to take money from one program and provide it to another. And that can be a lot of policymaking, and there are very good reasons often for doing that. And it's often not across silos, but from one child welfare program to another, or one child health program to another, et cetera. And so I came from the world of finance, the CDFI sector. And we always said that an investment is as good as the information it's based on. And the challenge is that these investments here often aren't based on a lot of information. Now, that's the bad news. The good news is that we know that there are interventions that are working 30 and 50 and 70 and 2 times better than business as usual. The veterans' PTSD intervention I described is way off the side of that chart, 270% better than business as usual. So the notion is, and we've talked to a number of folks and think this is possible, what if we could be at the other end of that scale and identify interventions that are consistently achieving 25% better results and shift our resources to them. So 25% better results, 1.25x. This is what it would mean. It would mean that we get 25% better outcomes for our spend, or 25% better, greater buying power. So what's 25% of $800 billion? That's right, $200 billion. We've got some mathematicians in the room. $200 billion isn't insignificant. The Congressional Budget Office scored Obamacare at $120 billion a year. $200 billion is the equivalent of Harry Truman Great Society level investment in social services. And that is a value proposition that does open people's eyes. So the general notion here is that if we're really going to move the needle on the intractable challenges and the persistent challenges of poverty, it's going to come perhaps less from robbing Peter to pay Paul, and it's going to come more from finding the solutions that are working and shifting our resources to the programs that are working best. You can't manage what you don't measure. We need to measure, we need to find what's working, and we need to shift our resources to those programs. And so we have a theory of change. We ask nonprofit social service providers to have a theory of change, and we have a theory of change for the Office of Social Innovation. First, we need to identify what works. We know government's good at funding innovation, from pharmaceuticals to defense to energy. We're less good at funding that in the social sector, and we need to be. We need to staff evaluation and fund it. We need agencies to have chief evaluation officers at the federal and all other levels. Use social and behavioral sciences, administrative data, et cetera. We need to fund what works through tiered evidence funds like the Social Innovation Fund and I3, through pay-for-success strategies. And we need to support the social sector. We can't expect the social sector to turn on a dime. I feel like nonprofit leaders and nonprofit employees are American heroes. They take less pay and less job security because they believe in really making a difference for the populations they're serving. Before they do anything, they know they need to keep the lights on. And in order to do that, what do they need to do? Well, they need to have glossy materials, they need to be politically connected, they need good relationships with their grant officer, they need to fill out forms in triplicate, they need to be good at all of this compliance, which takes their eyes off the ball and distracts them and some of their best talent from the outcomes that we would like to see them achieve and that they would like to achieve. So we need to do better. We need to connect them with evidence of what's working, and we are doing that by investing in clearinghouses, which are like a good housekeeping seal of approval for programs that are working. And we need to get better at disseminating that, using TA dollars to disseminate that knowledge to the community and connect those communities with the data that they need to quickly and iteratively understand their impacts. So I mentioned the key objectives for government intervention. And I mentioned our theory of change. Pay for success sits at the center of that because it helps us experiment. It continuously adds to the evidence base, and it allows us to cross silos and be creative. It helps us replicate and adapt the programs that are working best and try new ones that we believe are promising. And it begins to get government to pay for outcomes that aligns the incentives that honors the work of our social service providers and the communities that they're serving. So with that, I'd like to thank you for your time, and thank you also on behalf of the President for your service to communities everywhere. The way we're going to move the needle is by being innovative. We know that sometimes government can make that difficult for you, and we are looking at new ways and advancing new ways to get out of the way so that you can do the great work that you're doing and so that we can support you in doing that. So thanks very much.
Thank you, David. At this time, we really want to take the conversation from up here. We've been talking about some national efforts and hearing from thought leaders in the space and people who have done this to a local level. So we really would like to hear from all of you and what you discussed in your small groups. So at this time, I'd like to invite Gavin back up. And Gavin will be joined by Andrew McMahon, Managing Director of Government Affairs and Innovation at the Corporation for Supportive Housing.
Thank you very much, and I think Gavin is in the back, and we're going to kind of do some co-facilitation here to get some feedback from all of you all. But first of all, just another big shout out and thanks to Dave Wilkinson for his leadership at the White House that really is, I think, facilitating and pushing forward a lot of the policy change that it's going to make all the work that you all are doing and that we're doing collectively easier to do and more impactful over time. And the other thing to mention real quickly, so I'm with CSH, the Corporation for Supportive Housing, and we are greatly appreciative of the opportunity to participate and be here with all of you all today. I think at CSH we are keenly interested in the promise of Pay for Success, and I think that, you know, based on all the conversations we've had this morning, when we think about the role of Pay for Success as a policy lever to reform public policy and shift the way we allocate budgets to things that work, the way that we're using data-driven solutions to invest in those things that work. And I would say most importantly, I think from where we sit, you know, the Pay for Success industry represented by all of you all and a host of others, you know, I think we talk a lot about the kind of the capital from the funding perspective of what it's going to take, but it really is the human capital of all of you all in the room and all of the partnerships and kind of cross-silo making that we do that really is going to create the difference and I think most importantly have a huge impact for the individuals and families we're all trying to serve through this work. So thank you to you all for your efforts. So we are going over the next roughly 30 minutes I am cognizant that we have lots of smart people and we have a lot of tables and we have 30 minutes. So I don't know that we're going to be able to get to every single one of you. But with Gavin's assistance, I think we do want to spend the next 25, 30 minutes hearing from you all about, as we've had this conversation today, what are some of the key questions that you've kind of came up with or that were kind of going through your head as we've been talking? What were some big kind of comments or ideas that really struck a chord for you, and any kind of aha moments, so that we want to be able to kind of continue this conversation with all of you all. So be able to catalog that, and as Gavin mentioned too, be able to highlight and catalog kind of key questions folks have, so that as we can develop kind of a FAQ about kind of social impact investing and the issues and opportunities that it presents. So Gavin is in the back.
So I have the first question is from the folks on Twitter, actually on the webcast. And it has to do with the use of pay-for-success kinds of programs. How do you address the problem of gap funding for social innovation projects?
How do we address the gap financing? So it's interesting. I mean, I think one of the things that we actually have been talking about, and as others can certainly chime in as well, but I think that really is where, I think from where CSH comes in, is that kind of that upfront working capital fund that we talk about, that I think we were talking about at one of our tables. Of there's a lot of ideas about thinking about it as a SIB or some social impact investment, but at its core, it really is kind of this working capital front. So where can we get the upfront capital? And I think, promisingly, we're seeing interest and investment in those kinds of working capital funds through philanthropy, as well as other impact and institutional investors. So do we have somebody? There we go. Here's our first representative.
Hi, thanks. So one question that our group came up with was, is there a way to reinvest municipal reserve funds if a project is not successful? So I guess this is a question to, folks who are working on launched PFS deals right now. Yeah, so the question is there a way to reinvest municipal reserve funds if the PFS deal is not successful? So I guess when we were talking about this, we were saying, at a municipal level, there are probably funds reserved to pay back the investor for these success payments if the intervention is successful. But if it's determined that the intervention is not successful, what happens to those funds that are in reserve?
Great. I think that's a good question. And so let's be clear, too. I think in part we wanted to be able to kind of raise these questions. I'm certainly not up here at the lectern with the answers to each of these. Let me be sure. Right? Jeff knows exactly how those municipal funds are going to get repaid. No, but I think that is a great question. But in all honesty, I think we do want to be kind of raising these kinds of questions, because as we, as a learning community, move forward, I think it's exactly these types of questions, right? Then when we're talking in the big picture about these, what it comes down to is kind of the nitty-gritty of kind of how these things are going to work. So we want to be able to surface all of those questions and comments. Kevin?
Next question's over here.
And if you could just announce yourself, that'd be great too.
Sure. My name is Arthur Jimenez. I work at the Enterprise Center here in Philadelphia, in West Philadelphia. The question our group has is, being in the state of Pennsylvania, what is the role of the Commonwealth of Pennsylvania in issuing social investment bonds, or PFS contracting?
Here we go. Here's somebody up front here. Please wait for the microphone. Thank you.
Yeah, so my name's Colby Claybaugh. I'm the Harvard Kennedy School Civ Lab Fellow working with the Commonwealth on its Pay for Success initiative. And as many of you are aware, the Commonwealth is pursuing a statewide initiative on Pay for Success and has issued a request for proposals. Unfortunately for all of those who weren't aware, the deadline for proposal submissions was October 1st, and we are currently in the midst of the proposal evaluation process, the results of which should be made public fairly shortly. Commonwealth of Pennsylvania. Yeah.
Yeah, and I think, I mean, I would just add to that, right, and it was noted earlier, but I think there's a whole host of what we think about kind of the role government has. I think maybe it was Jeff who talked about it earlier, when the rubber really usually hits the road when states or communities put out an RFP of some sort to try to kind of at least select entities and interventions that they, really it's a right to negotiate, not a right to funding. But that, I think, really is a key role for government across all levels. If you have the microphone, yes.
I'm Joan McConnon from Project Home, and one of the questions at our table was, since many of the interventions are preventative, so you have the upfront cost and then you garner the savings, is the vision for sustainability that the government entity that is garnering those savings is in theory to use those savings to then capitalize the next cohort of people that are supposed to go through the intervention? Like, what is the sustainability model for this?
So that's an excellent question, and others can certainly chime in. I think in short, I mean, in a simplest term, I think that is true. I think one of the things that's really interesting is, from our perspective, and I think others can speak to this as well, but is trying to think about and how critical it is then that as we're doing these deals that we have the OMB, Office of Management and Budget, or that equivalent agency engaged and involved, because the only way we're going to be able to solve that kind of wrong pockets problem of investing here and creating savings here is through kind of the entity that has that kind of purview and authority across levels of government. I think from, certainly it's from CSH's perspective, we do look to that both in terms of real dollar savings of being the reinvestment vehicle, and also the proof of efficacy, which quite honestly can rule the day sometimes, and certainly sometimes does not. But I do think there's a sense of thinking about where we can, there's one of the big thicket issues we all have, right, is kind of this notion of cashable savings, and where could you actually see savings versus where might you see cost offsets in budgets, or in the healthcare world, bending the cost curve and trying to make investments based on projections that were this high, and you're saying your costs are actually going to be 5% lower than that, and investing the margin.
As a follow-up question to that, one of the dilemmas that we talked about at our table is that because many agencies are underfunded, the savings that get caught up may get those agencies to actual cost. From a government perspective or an investor perspective, what's the thought about how do you get sustainability within the operation that you're funding with your pay for success? Sorry, I didn't mean to put you on the spot so bad.
No, that's an excellent question. It's interesting. I can speak certainly in the supportive housing industry, what we are doing a lot of, and we were joking, but I should have been crying when I was mentioning this earlier, that in the world, and I wouldn't be surprised if many of you all live in a similar world, in the world of supportive housing, when we try to figure out what the quote-unquote costs are, we look at how much money the nonprofit supportive housing provider has been able to scrounge up from 35 different sources, and we divide that by the number of people or the number of families, and that's what it quote-unquote costs per person or per families. That is a horrible way to budget and to deliver and finance services. It's a horrible reality. It's not to be critical of, but I think so. One of the big pushes that we are making, Gavin, to your point, is trying to think about doing actual analyses and beginning with a fairly blank slate and saying, what does it actually cost us to deliver these services? And I think from where we sit, social impact financing and pay for success creates an incredible opportunity to do that. So as we're speaking with potential investors and working with providers, we're saying, here's maybe what we got to perform the service before. This is now based on these analyses. This is what it's actually the cost of doing business is if you want it done at a high quality level, which is necessary for achieving the outcomes that the investors are looking to meet.
Hi, I'm Kevin Kelly from Inglis. Andy, hi.
Good afternoon.
How are you? So it seems a lot of these programs are really funding mechanisms to fund great ideas. So the idea is funded, the idea works, the bonds are repaid. Is there any? There hasn't been discussion. Maybe it's obvious, but is there anything in the business plan or the vision statement that talks about what happens next when that funding goes away?
Yeah, so I think that's a great point, and I can tell you, I think from where we sit, this is where when I was so delighted when we were having this conversation earlier on, talking about these initiatives as a policy lever and a way to change budget allocations. And one example I would use that we're looking at is looking at people who are in institutional care settings where states and the federal government are paying an exorbitant amount of money not to integrate people into the community. And so I think where the kind of sustainability and the expansion of that comes from in some of the initiatives, at least that we're looking at, is trying to use social impact investment and pay for success to basically demonstrate for these 500 people, we are going to get them out of these institutional care settings, getting them connected to safe, decent, affordable housing in the community with all the supports they need, including a whole array of home and community-based services financed by Medicaid, demonstrate the efficacy of that to the state in terms of real dollar savings that are reduced for their kind of match share to Medicaid. So not to go too much in the weeds, but most states it's roughly around 50-50 match between feds paying for Medicaid and states paying for Medicaid, and actually demonstrating models that are reducing those costs. And I think from our perspective in working with a host of state OMB directors is using that model and actually being able to prove that out. And in some cases, what government has said, we talked about this earlier, I think it was one of the very first questions that Ian put up there was, well, why don't we just do this ourselves? And there's a whole host of reasons, like the substitution effect that Dave highlighted with the fire and the pitchforks of existing constituencies. But I think from our perspective, the ability to prove that out and demonstrate the reduced costs to the state, then it certainly is incumbent upon that state to carry that forward. There's not a mechanism other than kind of doing another pay for success contract, kind of follow it along with it, which you could do. But I think it is then kind of it will be a state or government decision. Yes, sir.
David Cohen, Ben Franklin Technology Partners. In a lot of cases, pay for success is a very long time frame to implement and get the results from. And how do we deal with that in terms of a lot of governments have very short budget periods, looking at the immediate fiscal year, next fiscal year, and also the need for immediate results in many cases to basically justify programs due to political pressures and operating. So the question is looking at the issue between, on the one hand, pay for success being generally a long-term proposition, and the more immediate needs of government and bureaucracy to basically show results and deal with immediate issues.
Sure, it's a great question. I may put Jeff or somebody on the spot if we could have a microphone to say, because certainly, in the realm of supportive housing, just to be candid, that is one of the areas where over the course of 3 to 5 years, we actually can see that measurable impact. So I'd like to ask Jeff or somebody to speak kind of from their perspective on initiatives that have a longer term window.
That's a great question. There you go. The incentives are a little bit interesting because for financing reasons, it's much easier to do it on a short time cycle. But part of the purpose here is to invest in prevention and measure outcomes that are going to be generated years down the line. So to me, that's not a bug, that's a feature, that we're forcing government into a longer term investment horizon and conversation. The flip side of that is you then take on what I think Andy referred to as appropriations risk, and thinking about how we obligate future funds that may span to a new legislature, new city council, new executive is difficult, and that's priced into the deal. And similarly to the last question, we also cannot obligate future legislatures to pick up and fund something even after our SIB is done, as much as we'd like to. Say, if this is successful, you need to pick this up because it's better for participants, beneficiaries, and for the taxpayer. So in general, I like the fact that it forces all of us to be thinking longer term. The annual budget cycle, I think, is it's very difficult for nonprofits to deal with that annual budget cycle not being able to plan, and this level of funding, and in fact, I'm looking at my friends from the Center for Employment Opportunities back there, they're getting 5.5 years worth of patient capital that's going to be there and they can count on it, and gives them flexibility to change their program for best outcomes within that. So we're big fans of the longer time horizon.
Great, thanks, Jeff.
Good afternoon. My name is Monica Steigerwald, and I'm with Philadelphia Academies. And our question is somewhat related in that we've heard lots of opportunity to explore pay for success, but we were wondering what are the situations where pay for success is not at all appropriate? what are the red flags that we should be looking for?
I think that's a great question. I can certainly mention a couple of things from CSH's perspective, and others can chime in as well. I would say one that's interesting is that question that we were talking earlier about kind of innovation or replication, and quite honestly, I think the fact that there's a lot of interplay between those two, but is kind of the evidence base or the ability to adapt the evidence to say, here's the proposition and do it. So I think there is some question on both sides of that coin in terms of whether or not we're looking at something that has a long and rigorous evidence base versus the financing innovation. I think, from CSH's perspective, I would say about the single biggest thing from our perspective on that is around data capacity and analysis. So there are a whole host of things, and we've certainly talked to a lot of communities that, right, as we've talked about all these pay-for-success contracts, right, they're all predicated on agreeing to some level, some number of metrics that payers and investors and providers are all agreeing to. And if we can't trust if all those parties can't trust in the veracity of the data, if you don't have mechanisms that can, quite honestly, at least from where we sit, have good data for figuring out the targeting of the intervention on the front end, and on the back end being able to have the administrative or other data systems in place that can actually verifiably track the outcomes. I think from where we sit, that would be kind of a fatal flaw, that interventions where there may be a lot of success, but it's all anecdotal, and it's those sorts of things, I think, is a key area for deciding that, there might be something really great going on here. It might have a huge amount of impact, but absent the ability to use administrative or other trustworthy kind of data sets to prove that out, I think, is a key issue.
Hi, Amy Wallace with Discover Bank. As a nonprofit who is involved as a service provider, what are the risks, whether they be reputational or otherwise, kind of downstream, that you're evaluating as you consider whether the pay-for-success model is going to work or not? MRDC, or MDRC, isn't here today to talk about the Rikers Island and how that impacted them downstream, either their ability to attract future funding or do future projects. So just wondering how you're evaluating that, considering that there are so few, and that there's a lot of scrutiny on the ones that are happening.
Sure, and I think it's a great question, and I think as we talked about earlier, there is a degree of risk-taking that is going on here, right? I'll just speak for CSH as we're engaged now in several of these, and we'll be working on a host of others. If they don't go well, I think there is some degree of reputational risk. I think we seek to mitigate that very significantly through very rigorous due diligence of all parties to a transaction, and making sure that we are working on the investor side, on the government side, and on the provider side with entities that can deliver. And I think what I would say really importantly on that front, from where we sit too, and we talked about this a bit earlier, but I honestly feel like in every conversation there's not nearly enough discussion of it, and that is the providers and the actual execution of the intervention itself. And so for us, the huge share of the due diligence and underwriting that we're doing to kind of mitigate that risk that we do have is on the provider side, and can we actually prove this out? On the financing side, I would say, just as a nuts and bolts matter, as we're exploring, is we're certainly looking to create LLCs and special purpose entities or vehicles, SPEs, to mitigate on the kind of financial risk side of it, so that as an organization we are accountable to this project 100%, but the organization itself is not going to get wiped out by a deal that goes awry.
Hi, Katie Martin with Pew Charitable Trusts. We have a provider at our table who actually brought up a really good point in that how are we in Pay for Success incorporating the needs, the wants, and desires of the clients who are actually being served, both in the feedback loop at the end when you're evaluating the success of the project, but also before the project's even created, while you're deciding what is your intervention going to be.
So that is an excellent point and question, and I can speak, and others can chime in from their experience as well. From CSH's perspective, I can tell you that we have actually essentially required in a couple of different places where we have in our world kind of tenant boards that are involved. So I think for us that is a huge issue in terms of the organizations that we seek to partner with. Having tenant empowerment and tenant boards as part of their processes is really important from our perspective. And the other thing I can say from our perspective at least is that the efficacy of supportive housing, we can certainly point to all sorts of studies that demonstrate, the efficacy and the reduction in utilization of jail and ER and detox and all those sorts of things, which are really critically important. But more important to that is in our world is kind of the notion of kind of housing first and voluntary services. So central to our model is kind of a tenant and resident choice model, so that in the world that we operate in, we work with individuals and families who have been quote unquote mandated probably hundreds of times to do things that didn't work. And so those don't work. And so we have, as a philosophy, an organizational philosophy, a focus on tenant choice. And what we say in our world is that services are voluntary for the resident, but not for the provider, right? So you want to be constantly kind of providing, what we call kind of assertive community engagement and treatment models, so that it's not kind of optional from the providers, but it is, the point is to make the services something that the residents and tenants want to engage in.
My name's Kate Farrell. I'm also from Inglis. And the question we spent a lot of time discussing at our table is what Mr. Wilkinson called the wrong pocket program. That, for instance, you have a city that undertakes a project that results in savings to Medicare, Medicaid, or to the state. How do you structure these contracts such that you get the free riders to pay their fair share?
Mm-hmm. So again, I just can chime in, and Dave can chime in as well, but. We have some water up here for you, Dave. But I think, I will say for CSH, and my hunch is that for others, but they can speak to it, is that is where it is so critical, and as you look at the initiatives out there, that there is some origin or huge commitment on the side of the OMB or the OMB equivalent, right? Because if you're going to be able to say, and I always get a good chuckle when we have conversations about Sean Donovan, because he was the head of HPD in New York, Housing Preservation and Development, and he was instrumental in launching the very first frequent users initiative we did. He went to HUD and had that exact problem, and now he sees across that purview and has that authority across the agency. So I think from our perspective, and I think we see Pay for Success as a huge opportunity to address some of the wrong pockets, because you are then engaging with the OMB heads who can see that the impact that they're having in one agency is cutting across to another. They're still going to have the issues to sort out, to be sure, but I think the cross-cutting nature of the budget process and the engagement of the OMB or OMB equivalent is critical, because then you're not kind of just looking to HUD or their budget, or quite honestly to HHS and their budget. So I think the OMB is the key to addressing the wrong pockets problem.
I'm Don Bernhardt with the coalition that's working on the Lehigh Valley Early Childhood Project that was mentioned earlier.
Oh, great.
We had a good discussion about whether it's possible to develop metrics that start to sort through some of the extraneous variables that come to play. Like in the early childhood world, you deliver a child that's healthy and ready to learn to kindergarten, but you deliver them into an underperforming school, and before you know it, things are off the rails. And I guess the question really was does collective impact approaches have some potential to start to address that, to bring people together who are bringing different things to bear on the same problem?
Excellent question. I'm going to turn to Jeff here on this one.
Thank you. So this is near and dear to my heart. We've had an ongoing debate within social finance around this, and I think at first blush, a lot of us who actually put these together recoil in horror, because the idea that what we're doing now with just one provider is really tough. And then you multiply that through collective impact, that seems really hard. After I talked with Jeff Edmondson in Cincinnati, Strive Cincinnati, who was one of the kind of founding fathers of the collective impact movement about this, and it sort of changed my mind. And here's what collective impact has going for it from this perspective. There's already data in place flowing. If you're a mature collective impact site, you should be looking at collective administrative data together with your collective action network, right? So you've got data already flowing, which is a big impediment to what we do in Pay for Success. Theoretically, you should have government involvement and buy-in in whatever the goal is, which is also critical to what we do. So now, after having talked with Jeff, we actually wrote a blog about this together. We think that there are places where collective action, where collective impact is mature, that you could use Pay for Success to accelerate and scale up one node within your cradle-to-career collective impact. But again, that would have to be fairly mature. You'd have to have data and the goal and so on in place. The question then becomes, how do you attribute and provide repayment to the different providers, which is a complexity that we have not answered yet.
Great. Thank you, Jeff. And I'm going to take the facilitator's prerogative and cut us off right there because we have the Mayor President. Now I'm going to turn it to Gavin.
Well, thank you, everybody, for the thoughtful questions. Please leave your questions on the table so that we can pick them up, and then we'll try to develop those into a frequently asked question. I know there's a desire to learn more. I know I have it. And there's a couple more opportunities coming up. On November 9th, the Penn Center for Public Health Initiatives is holding another conference on social impact bonds at Penn, so that would be one that you can participate in. And then on December 1st, the Philadelphia Social Impact Journal is also having a conference on innovation in social innovation, both of which will create great opportunities for the conversation to continue. So thanks very much.
Thank you, Gavin and Andy. At this time, I'd like to introduce Mari Porter, Executive Director of Philanthropy Network Greater Philadelphia, to the stage. Mari Porter joined the Philanthropy Network Greater Philadelphia after working for the City of Philadelphia, where she was Chief Grants Officer and Executive Director of the Mayor's Fund for Philadelphia, raising nearly $50 million in public and private grants in under 3 years. Previously, she served Mayor Michael Nutter's administration as Deputy Director of Finance for Recovery, helping to set strategy and attract, report on, and oversee $350 million in federal stimulus funding during the Great Recession. Mari's been a champion of Pay for Success financing in Philadelphia, and we're thankful for the support we received from her and her team in planning this event. Thanks, Mari.
Good afternoon. We're in the home stretch now after really kind of illuminating sessions and questions from you all. So I'd just really like to thank, on behalf of all of us, the Fed, Noel, for bringing a group of kind of very different actors from different sectors together. I know personally, I've been talking to lots of you individually, so it's great that we can all kind of come together in a room in this region to talk about a pretty complex topic. So before I get moving on, the accent is from New Zealand. It has 15 years in London as well, so that's what's happening here. So I'll, because I know people aren't listening to me, they're just thinking, where is she from? So we've got that out of the way. So my name is Mari Porter. I'm the Executive Director of Philanthropy Network Greater Philadelphia. We are the membership organisation for foundations and individuals who are active in giving in the region. I'm really thrilled today that we have many of our members here. We have the Pew Charitable Trust, we have the Barra Foundation, the Mayor's Fund for Philadelphia, the Greenlight Fund, the Nonprofit Finance Fund, Inglis, and probably a few others, and apologies if I didn't see you. So, philanthropy is very deeply interested in investing in solutions that are innovative, that are evidence-based, and that can scale through a combination of public and private dollars. So Pay for Success is really in this kind of sweet spot for strategic philanthropy. And it's no surprise then that philanthropy has played a role in every single Pay for Success deal that's been executed so far. And I think that really speaks to kind of a testament to the flexibility and agility of philanthropic dollars that we can deploy should we wish to. And I know some of you are probably thinking, well, that's okay for Bloomberg Philanthropies and some of the national foundations, but What about in our region? And I will say, in the short time I've been at Philanthropy Network for 9 months, we've already had 2 very well-attended sessions on Pay for Success by our membership, thanks to Jeff from Social Finance and his team and Maya Giacomo's at the City for helping us think that through. And I really say there's been a real shift, even in the short time I've been in here, in this role, with philanthropy really thinking about different models and different ways of deploying their capital, both the corpus and on the grant giving side. So I think you'll see in our region a shift start to make, and many of the leaders of that are in the room today. So, but I'm reminded that every time I think I understand Pay for Success, and I've been thinking about this for a while, I really don't. Because once again, I come to programs like this and I realize I've learned a whole lot more, and there are things that I really don't know. And as Andy said, you know, it's really about starting with the story. I think PFS is very complex. And you're on a PFS journey, anybody who's kind of deeply engaged in this work. So I just wanted to talk very, very briefly about, I guess, the Philadelphia story, and that has to start with, of course, Mayor Michael Nutter. You know, while I struggle with Pay for Success and really trying to understand it, this guy really, really gets it. And he's been thinking about it for probably longer than any of us have. I've had the pleasure of working with the Mayor as Chief Grants Officer. We both set up that position, recognising that federal stimulus dollars were going to be turned down, if not turned off, it felt like sometimes after the recession, and that as a city, we had to be a lot more competitive, a lot more innovative, and less reliant on federal funds, and we really needed to braid the public and the private. So I know in that role and working with Mayor Nutter, trying to pull in money and braid this kind of public and private funding, that he was on his own PFS journey, if you like. And I think it started, Mayor, with a briefing that Mayor Bloomberg held for mayors from across the country on Pay for Success. I think this was late 2011, maybe early 2012, Katie, where Mayor Bloomberg brought Mayor Nutter and other mayors together. Probably, I wasn't at that meeting, I wasn't in the room, but I can imagine for some mayors across the country, this is snake oil. What is this thing? But for our mayor, who's a policy guy, a policy wonk, this was gold, right? This was absolute gold. Imagine bringing private capital to invest in evidence-based problems that are intractable, with little or no risk to the city, when the payout, in theory at least, would be less than what the city currently pays. I mean, that is municipal mayoral gold to a policy guy, not snake oil. So fast forward 6 months, after Mayor Nutter has received that briefing, it's clearly gone in way down deep, I start to get emails from the mayor. Very long, lengthy emails, basically laying out for me what Pay for Success is like. He doesn't quite use that language, so I resent him an article. That was my first mistake. Ordinarily, that would be fine, but these lengthy emails were coming over the summer. The mayor was in the Caribbean with his family, and he's sending these very, very long, extensive emails. When the mayor leaves town, his whole staff is like, thank you. We want a break, we want a bit of a relax. That's what I thought my summer was going to be. No. So, alas, I responded to the mayor. That was the first mistake I made. These emails kept on coming through and through and through. It almost got to the point like he was an underwriter for TRF. They were that detailed. So I eventually caught on. Maybe, Mayor, that could be a next career move for you, perhaps. But, you know, I caught on, and so my responses to the mayor were, all good, Mayor. Let's talk when we get back. Still didn't stop. So, Mayor, I'm not sure if you know this, but I had to go to the Chief of Staff because this was not good vacation behaviour to write about PFS. So we had to shut it down. The Chief of Staff shut it down. I still had a job. But I say that to all say, all joking aside, the mayor was very serious about this. He was very serious about trying to find new, innovative ways to really help solve some of the difficult problems that we have in our city. So with that, and not wanting to get any more of these emails, with Maya Giacomo's and Katie Martin, who are here leading in the policy office, we in the City of Philadelphia pulled together a small team working with the budget office, because you have to have the finance guys and girls around the table. And we really went through a thoughtful process, and we brought on Bill from Nonprofit Finance Fund and his team. I'm not sure we ever paid you, Bill, for that. Probably not. And for a year, there we go. We appreciate it. And over a year, Bill and his team helped educate the mayor the senior leadership team, the deputy mayors, and really senior staff about what Pay for Success is and the opportunities it could bring to the city. Through that year-long process, we came out with 2 areas that we thought had the most promise, and that was partly based on the challenges that were in front of us as a city and the issues that we needed to tackle, and also about leadership. It was really the leaders in those departments that could really see the potential and we knew could kind of push this forward. So those 2 areas were in the prison system, recidivism, and the other one was in DHS, out-of-county placement. Through that process, through the policy office, the city released an RFP in 2014, and Social Finance was successful in receiving that RFP, and they undertook a feasibility study for the city in those 2 areas. So I just encourage you to look at the city's feasibility study and the work that's gone on there. Since then, we've had an RFP also from the Commonwealth of Pennsylvania. So I say all this to say that this is a really exciting time. There's a lot of momentum in this room, and I know there's really a lot of momentum in the region to really kind of push forward on this, and we've had fantastic leadership by the mayor, and I'm sure that will continue through the next administration. So with that, please welcome Mayor Michael Nutter.
Good afternoon, everyone, and Mari, thank you for that introduction. Although I was saying to Maya in the back, I mean, you didn't have to put all my business out there about vacation activity. That's really going to help me the next time Lisa and I go on vacation. That's just wonderful. Emailing with Mari again? Why can't you just sit your butt down? I look so forward to that conversation. Good afternoon, everyone, and thanks. Seriously, thank you for having me at this very, very important conference. I want to thank, in a more serious way, thank Mari and her work at the Philanthropy Network of Greater Philadelphia, not only for the introduction, but more importantly for all the work and responding to all those emails and entertaining my nascent knowledge, at least at the time, of Pay for Success or social impact bonds. Pat Harker and Teresa Singleton and the entire team at the Federal Reserve Bank, thank you so much for organizing this important conference. Please give them a big, big round of applause. David, thank you for being here, and I've heard already about some of your comments with regard to your keynote address. My people keep me very, very informed, so I'm up to date on that, and I'll make some comments about one of your comments later. Ivan, it's a good thing. It's cool. Ivan Barsky and certainly the great team here host so many different kinds of events here at the National Museum for American Jewish History, the only museum of its kind in the United States of America, and I want to thank them for being our host today. I mentioned her offhand earlier, but Maya Giacomo is our policy director in the government, and she mentioned, as Mari mentioned, she worked with Maya and, of course, the one, the only, the incomparable Katie Martin. Where did she get to? Katie, who was in the policy office until recently and now is a big shot at the Pew Foundation. We do miss her dearly. Garrett, good seeing you. Thank you again for our partnership and relationship. 2 other folks that I want to recognize and thank for their work. One, I've had the opportunity to get some advice and perspective on all this from Melissa Bradley. I thank Melissa for her continued focus in this area. But the real champion of all of this effort by the city really is my wife, Lisa. She is very, very focused in this regard. And so I'm well-versed and well-briefed in these aspects, and it's really because of Lisa's focus and attention on these matters. So in her dual role as, of course, the president of Philadelphia Academies and First Lady of the city, please recognize her for her work as well. So I want to take a few moments to talk about this important opportunity for public, private, and nonprofit representatives to learn and discuss more about Pay for Success. I want to thank again all of you for participating in this conference and trying to gain a better understanding of the purpose, uses, and the risks of Pay for Success and social impact bonds. Although I have to say, and I've at least said to the team, the more and more we can talk about Pay for Success and less about social impact bonds, I think ultimately we'll all be the beneficiaries. I could not understand what that was about. I come from previously a investment banking background, so I know a little bit about bonds, and I just could never figure out what in the world people were talking about. So we're going to float a bond, and then we're going to get a debt service, and then no, it's not that. And the conversation would go nowhere. So thank you. Pay for Success. Let that be our watchword. And I know you've already discussed, in many ways, the big picture about this issue, not just here in Philadelphia, but across the United States of America. But I do, for my purpose and our purpose, I want to bring it back a little closer to home and some of the things that we're focused on here, but also things that we want to do. Philly, of course, is a big city, fifth largest city in the United States of America, solidly in that fifth spot. You're also, right at the moment, situated within the most historic square mile in the United States of America. And so, again, welcome to Philadelphia, the city of brotherly love and sisterly affection. We love having you here. We have our many strengths, and we also have many, many challenges as a big city in America. I've had many, many years in public service. I think, as everyone knows, I'm at the tail end of my second term as mayor, 8 years serving my hometown, but also 14 and a half years in elective office as a member of Philadelphia City Council. So at least on that side, 22 plus years of elected public office, and I've had a chance to see a lot of things happen in my hometown. I would say, though, that being mayor, whether it's here or anywhere else, small, medium, or large city, it really doesn't matter. It's only really a function of how many zeros are after whatever it is that you're measuring. But being mayor is very different than virtually any other elected office other than president. You play a very, very direct role in the lives of your citizens, and at the same time, they hold us very accountable for getting stuff like trash collection, snow moves, street cleaning, fixing potholes, and everything else. They hold us very accountable for getting stuff done. This is a job that is very, very close to people, and in many, many instances, as Lisa and I have experienced, notwithstanding the opener, I hate to bother you, so don't. I hate to interrupt your meal, so go away. But that never happens. And folks want to talk about what they want to talk about, when they want to talk about it. At the barbershop, in the supermarket, standing in line, doing whatever it is that you're doing. This is the most important thing on my mind. I'm never going to see you again, so I have to have this conversation with you, even though I had no expectation that I was actually going to run into you at this moment. But let me talk about my problem. So, but that's a job, and that's a part of my love for this job at the local government level. Our constituents do depend on us, and especially, again, on the mayor. What our administration does or doesn't do actually makes a difference in people's lives, and whether it's educating their children, finding housing services for the homeless, working with returning citizens to reintegrate them into civil society, or ensuring that vulnerable children are safe through our Department of Human Services and so many other parts of the government. Now, there were many, many lessons that came to all of us through the Great Recession. But I think the one thing we all learned is, A, it is almost impossible to run a government with no money. And B, local governments do, in fact, have a finite amount of resources. We do not print the money. Even though we have a Federal Reserve Bank and a mint here, I have no access to either one of them. They would never allow me to go in those places. But the reality is, seriously, there's only so much that we can do on our own. And that's why, and I believe the Great Recession really accelerated the idea of public-private partnerships. We were desperate to still try to get things done, did not have the resources to do it, and had to go outside of ourselves to figure out, how do you still run the place? How do you make things happen? How do you move forward your agenda in an environment where you have fewer resources coming in, maybe fewer employees, and more unemployment in our city and other challenges that the recession gave us? And so public-private partnerships really became a way for us to still get stuff done and collaborate with other people in the process. Recent history suggests that these partnerships can be a tremendous tool, they are, in addressing the many pressing challenges that we continue to face. Just because we're in a recession doesn't mean that some problems went away. If anything, some were accelerated, exacerbated, or new ones presented themselves. Public-private partnerships are, in fact, about knowledge, infrastructure, passion, and money. When government partners with groups outside of the government, including business and philanthropic communities, our ability to provide more impactful public and social services to our residents is greatly improved. And while partnerships help us to achieve goals and serve our constituents, particularly in an environment of resource scarcity, government must also focus on getting work done in an effective and efficient way, using evidence-based approaches and evaluation to determine the right strategy to address any particular challenge. The government cannot assume that a solution will work, nor can we base complex policy choices on gut feelings and anecdotal scant information. We need to know that a new approach will in fact work and that it has increased importance and relevance because of data and evidence-based practices. Pay for Success, as you already know, is about the intersection of partnerships, money, and evidence-based approaches all coming together. And when done well, Pay for Success projects align our service providers, government and external funders around a core set of agreed-upon outcomes to improve the well-being of our citizens. Consider this. We know certain interventions and programs work, but more times than not, dollars, public and or private, are not clearly aligned to support and expand that intervention. These projects leverage private sector capital and allow elected officials to place taxpayer dollars only where results have been proven, thus allowing us to pay for positive social outcomes rather than a fee for services delivered. Now, I already knew that Philadelphia is, was, and will continue to be great at partnerships. I'll mention just a few. Our Work Ready program for getting young people summer jobs, our Startup PHL program out of the Commerce Department, and even our Indigo Bike Share program. I also knew that Philadelphia was good at evidence and evaluation to determine best practices, and we're working on multiple projects. The Philadelphia Police Department, the Department of Behavioral Health, the Health Department, and the Department of Human Services, and others, have dedicated staff and resources to evaluating their own services, identifying the evidence for certain operations, tracking that performance and outcomes towards stated goals over a set time frame. Various departments have built partnerships with academic institutions to help evaluate the impact of those services. Some researchers are even using our administrative data to conduct relatively low-cost, randomized controlled trials. The results of this work is actually improving and informing our work. We've invested in a central data management office that operates an integrated system of city administrative data, including mental health, substance abuse, child welfare, juvenile justice, lead exposure, and other data on a regular basis. This allows us to make decisions using a cross-section of related and important data that is often layered on top of each other. PhillyStat, our city's performance management program, tracks the results of work done by all city departments and then helps them to maintain a focus on problem solving, process improvement, and meaningful target setting. We've also centralized best practices on our website, www.phila.gov, that acts as a consolidating warehouse and clearinghouse, and other information resources are available to anyone who goes on our website. And of course, our city leaders use that information literally as a one-stop shop to get information in their respective fields. And we have many examples of pay-for-performance contracts where city government pays providers based on agreed-upon outcomes rather than a fee for service. Let me give you a few more concrete examples of how we work with academic institutions to evaluate the impact of our work and how we use data to drive our decision-making. In 2009, Police Commissioner Charles Ramsey proposed a new foot patrol project to impact crime hotspots throughout the city. For some who may not know, we refer to hotspots as those corners or neighborhoods with particularly high crime. Through Commissioner Ramsey's previous work, he was the police commissioner in Washington, D.C., he knew that foot patrols could be effective in decreasing crime rates and increasing community support of police. However, he needed to and wanted to prove it. The Philadelphia Police Department partnered with Temple University to conduct a randomized controlled trial of 250 foot patrol police officers in 60 of the most violent hotspots to confirm whether foot patrols were impactful in reducing crime. Following 3 months of implementation, violent crime decreased 23% in the targeted communities when compared to the control group. The study even found spillover effects of reduced crime in surrounding neighborhoods. So areas where we were not engaging in direct foot patrol activity, even those areas benefited as a result. Overall, there were 53 violent crimes actually prevented in some of those areas during the summer of 2009, literally as a result of foot patrol activities. And so now, the policy here in the city of Philadelphia is all graduates, cadets from our police academy in their first year all go on foot patrol. They will only see a patrol car as it's going down the street, driven by another officer. Every police officer in Philadelphia, in at least their first year and some for their first 2 years, all go on foot patrol in districts all across the city. Knowing our strengths and what Pay for Success utilizes, I was interested, as Mari painfully pointed out, I was very interested in whether Pay for Success would work for our city. We did form that internal working group in 2013 to explore Pay for Success and determine its applicability in Philadelphia. As was mentioned earlier, the Nonprofit Finance Fund and Bill and his team, who are here today, guided us through that exploration. And with that information, we decided to move forward and actually put out an RFP for a feasibility study. This past winter, we commissioned the Pay for Success study looking at 2 outcomes. And again, Mari mentioned these: reducing recidivism for returning citizens and reducing out-of-county placement for youth in our child welfare system. The final report, produced by Social Finance, and Jeff Shumway, of course, is here as well, and we thank Jeff for the great work. Thank you so very much. And my notes say that now I'm supposed to ask the crowd to recognize you and Social Finance. Can we please give Jeff a big round of applause? I would have done it anyway, but it's really right there. The report is available on the mayor's office website. In essence, the report showed that Philadelphia is well positioned to actually conduct a Pay for Success project, but in order to do so, and with strong return on investment, we should also partner. We suggested we should partner with our colleagues at the Commonwealth of Pennsylvania. In many ways, this is not a surprising finding, services that support our most vulnerable residents are often funded by state and local dollars, as well as the federal government. I was encouraged that the Commonwealth of Pennsylvania, through Governor Wolf's office, has now solicited proposals for Pay for Success projects in the same areas where we've evaluated the feasibility locally. And I hope that all of you remain active and encourage your own state elected officials to pursue this work as well. I also think we should consider whether there are other areas that may be ready right now for Pay for Success projects where the return on investment is strong enough for local action alone. For those of you here today and many others, let's continue to explore opportunities for government, investors, and service providers to work together to leverage this tool to support local innovation. But Pay for Success, but for it to be a viable program in Philadelphia or anywhere else across the country, we also need to invest in building government, nonprofit, and philanthropic capacity to do this work. We need all of our partners in this effort to continue to demonstrate our ability to work with others, and certainly with the investor community. And we need to show regional and national funders that we're ready for this increased level of investment and engagement. Investment is going to be critical for the continued success of Pay for Success and other evidence-based projects now and in the future. We also need to be bold and creative in how we approach problem solving in the future, focused on what we know works, scaling it up to be more impactful citywide, whatever the size of your city, and then throughout your particular region, and then, of course, across the United States of America. Pay for Success is a new tool, but it is a growing tool, and it is a more viable tool, and people are seeing that it actually can work. We need to use it in a direct way and we can positively impact the lives of many, many vulnerable people. I'm excited by future interventions. Look forward to supporting this work in the future. Today, we know that this can work. We also know that it can improve outcomes in people's lives. And all across the United States of America, whether it's here in Philadelphia or many other places, people are still in pain. People are still struggling. And we have to be as creative and thoughtful and impactful as possible with the dollars that we have at every stage of government, and certainly the nonprofit and philanthropic community. One of the things I wanted to touch on, and David talked about it, and I'll be using this term probably a lot over the course of the next couple months. I used to refer to them as just the maintainers of the status quo. I actually like your quote better, stakeholders of the status quo, whose main job and responsibility is to maintain the status quo, because that's what works for them. It has nothing to do with whether it works for you. It has nothing to do with whether it works for the citizens out there. But if it's working for the stakeholders of the status quo, then that's what they will do, because some people believe that systems were created for them, by them, and about them. And so as we go through this period of change here in Philadelphia, and there will always be change, whether at the local level, the state level, or even the federal level, the real issue is, how do we embrace these systems? How do we make them less focused on a person or personality or an administration, and just become the thing that we do? I did not invent trash collection. I did not invent snow removal. I did not, in our administration, create the idea that if there was a hole in the street, that we would actually fill it with material. That's been going on for a long period of time. And ladies and gentlemen, I can assure you today that on January 5th, 2016, potholes will be filled. Snow, if there is any that day, will be moved. Trash will get picked up. And why? Because it's what we do. It's a part of the thing. It's an essential component of the government. It wasn't Mayor so-and-so's idea or Governor so-and-so's idea or President so-and-so's idea. It's just what we do. And so these ideas have to transcend time, people, personalities, administrations, and become the new standard that we use to move things forward. And so a new administration coming in and figuring out all the things that they need to figure out, what this community, I call on you to do, and the call to action here is to make sure that you're talking to the next folks who will come. I have to hand off the baton, but the business of government must continue. Service to the people must continue to happen. This is not our idea. This has to be Philadelphia's idea. It has to be Baltimore's idea. It has to be New York's idea, San Francisco's idea, Cleveland's idea. You can name 100 cities all across the United States of America. It should just be a part of the component of what all of us do, because they pick up trash in all those cities. They move snow in all those cities. They deal with emergency management. If you dial 911 in any of those cities, depending on what you called for, you should probably have a reasonable expectation, notwithstanding whatever administration is, that a police officer or a firefighter will show up, because it's now the standard of what the government does. Let us break through these barriers. These, as one DC person described them, cylinders of excellence. Cylinders of excellence, where the stakeholders of the status quo spend morning, noon, and night trying to frustrate the efforts of those who are trying to make progress, because it may leave them behind, or they may not understand, or it's so new and different that why are we doing this in the first place? We heard that idea 20 years ago. It didn't work then, it won't work today. Well, I think 30, 40, 50 years ago, somebody probably thought it was the most bizarre idea that a person would have this material strapped across their waist and their chest to protect them in a car. People said no one will ever use them. Today, they've had to adjust the 18 airbags in your car to make sure that they don't damage you more than the car accident that you were in. There are so many things that were new at one time. They were bizarre. They were unusual. They were novel. It'll never last. Today, they're standard operating procedure all across the United States of America. We should take this idea forward, make it happen, break it down, help people to understand. Let it not be so complex. Let it be accessible to everyone. That's what Pay for Success is all about, because we all want success. We want the same things. Our kids to get a great education, folks to have opportunity, live in a great city, wherever it is, have leadership that is focused, that's innovative, that's paying attention, and willing to take a little risk. And then those of you in the field, back that person up. There will be mistakes. There will be failures. There is no great effort that's ever gone forward that someone didn't have a struggle or a misstep. Edison didn't get it right the first time out. But there are light bulbs all over the world as a result of taking that one risk and that chance. The same is going to be true for this. And people will be talking about the early days of this, and no one could understand it, and what was it really all about? And subsequently we'll realize what was all that consternation about. It's just a new way of doing business. Let's embrace it, let's enjoy it. Let's make Philadelphia the capital of Pay for Success and social impact funding. Thanks a lot.
That was a heck of a way to end the day. Thank you, Mr. Mayor. Thank you for your participation today. Thank you for your leadership on this issue, and thank you for your leadership of the city for so many years. I'm just going to end us. I know we're short on time, so I just want to end with a couple of thanks. I want to start off with huge thanks to our presenters. I think it's easy to get up here and share all the successes and the easy stories, and they did that, but they went even further. People shared their failures and their challenges, and I think we all learned a great deal from that part of the conversation. I also want to thank you all for your patience and being with us all day. And I want to thank you for your great questions, because they really demonstrate the energy and the enthusiasm that is present in the region. And I think we're going to benefit from as we move forward in trying to figure out where we go in this city and in this region using this model and this tool. So on behalf of the Federal Reserve Bank of Philadelphia and all of our partners who helped us shape this event, I want to thank you for your time, thank you for your energy, and thank you for your participation today. Have a great afternoon.
Your evaluations, could you drop them off on the way out at the registration table or leave them on your table? But we'd really appreciate